Well, hello, lovely people. I'm Christina with a K, and welcome to another installment of Transgender in a Blender, where I and my guests explore all aspects of transness from an unorthodox perspective. And I'm so pleased and honored to have today as my guest, Dr. James Morandini. He is a clinical psychologist and also the director of the King Street Psychology Clinic in Sydney, Australia. And for those of you who are familiar with my channel and the content, Dr. Morandini, along with Kevin Su, is pretty much like the only two medical professionals and academics currently studying autogynephilia, and which makes them actually more precious than gold and diamonds combined. So welcome, Dr. Morandini. Thank you for being here.
Thank you so much for having me, Christina. It's a real honor. And yeah, thank you for having this podcast as a space for people to come to learn about their experiences and have a positive and affirming voice regarding autogynephilia. It's also as rare as diamonds and gold. And I can say that as a clinician, who works with folks who have these experiences and for whom it's been really hard to provide resources that are going to be tolerable and affirming.
Oh, no, well, thank you for your kind words. I mean, but yeah, like the pleasure and the honor is all mine. And well, I'm doing what I can to be like an island of safety in a very choppy and stormy sea of like anti-AGP hysteria and anti-trans hysteria as well in general, unfortunately. But I'm doing what I can to setting an example. So, but yeah, I mean, I'm honored to have like such quality guests of high caliber such as yourself and my previous guests on here. So yeah, the honor's all mine. But so again, thank you for being here. For those of you, like as I mentioned, he is a colleague of Dr. Kevin Su, a previous guest here on my show. So again, it's like once you kind of like get involved in like the autogynephilic social networks, you'll find it's very easy eventually to kind of like interconnect and find other self-aware autogynephiles, and also like the academics who are very supportive of us and basically helping us to understand ourselves and present the case that autogynephilia should not be stigmatized or should be a motive of shame or repression, but can just be celebrated as just like another wonderful expression of healthy, vital human sexuality. So, so Dr. Morandini, if you could please, for the benefit of our guests here, tell us a little bit about your academic background.
Definitely, yes, and I agree with everything you said there regarding the need to destigmatize autogynephilia. Yeah, so my background is in psychology. I studied an undergraduate of psychology and then a doctorate of clinical psychology, which is akin to the PsyD programs you have in the US. And I studied a PhD, and my PhD focused on people's beliefs about why they were gay or bisexual, and how those beliefs about the nature and origins of their sexuality might influence their mental health and adjustment to who they were. And my interest had always been in sexual orientation and gender identity, and that spoke to my own experiences as an androphilic male, trying to make sense of my own sexuality growing up and my own gender nonconformity and various anomalous elements of my androphilic sexual orientation. And so for people that don't know, androphilia is male attraction. And so certainly what I was coming to terms with as a teenager was trying to make sense of what my sexual orientation was. And so I'd always had that interest coming into psychology. And over the years, I've been able to really, thankfully, link up with wonderful mentors and inspirations who have helped me to study this area, to understand myself, and hopefully to start to develop knowledge and expertise to help people understand and feel comfortable with themselves. And so some of those inspirations over time, when I was studying my undergraduate, I first came across Professor Michael Bailey's work, and it blew my mind. And I know that there are people who, the very scientific tone of Mike's work can feel confronting and can feel upsetting. And I'm not saying that at the time I was immune to that, but what was refreshing was to have someone who was wanting to write about how things were as opposed to how we might wish them to be at a certain point in our lives, and to have someone who was willing to tell the truth about these experiences was very inspiring, and certainly inspired me to pursue a career in psychology focusing on sexual orientation and gender. After I finished my PhD, this is in 2016, I worked as a postdoctoral fellow at the University of Sydney and under Alan Nimrod. And my work at that point continued, you'll see a theme here, Christina, continued to focus on how people's understanding of the nature and origin of important elements of their identity, like why they're gay, why they're bi, why they're trans, influences how they feel about being gay, bi, or trans. It was around that time I started to work clinically as well. And I was, from the beginning, I had an interest in working with trans populations, and I started to work at a private practice in South Sydney, where I've been working ever since with trans folk, and then got a job while I was still doing my postdoctoral research at the Gender Centre, which is a wonderful state-funded organisation that provides social work, housing and counselling support to transgender people across the lifespan. And I'm the team leader at the Gender Centre, where I still work a day a week, and I supervise junior psychologists in working with trans folk. And I've, in the last couple of years, established my own practice, King Street Psychology Clinic, which you indicated in your intro. And the majority of our clients at King Street are trans and gender questioning people, and probably a slight shift towards there being more trans masc people, but we see a lot of trans femme people too, maybe 40% of the caseload. And so over my years of working with transgender adults and adolescents, I've seen hundreds of clients, and some of these clients I've been able to have the privilege of working with for many years. So I've been able to see them come in as young adolescents, maybe 14, and now they're into their 20s, and I've been able to see the outcome of their gender journeys. And if we talk about the subject matter of this podcast, how many young male-assigned folk who are coming in with gender dysphoria that might fit this autogynephilic pathway, I would have seen well over 100 young people who meet this profile, and at least that again of adults coming in wishing to transition. And so over time I've been able to see how this gender identity pathway gets started and develops, and some of the challenges but also wonderful elements that can emerge from this, as well as how these folks often respond to gender affirming interventions like hormones and surgeries.
Oh no, that's a wonderful segue into what I would like the main topic of this podcast to be, which is counseling and care for trans youth. So of course, we can talk about all aspects of the care you provide to adults as well, but I feel like trans youth has not been the main subject of my previous podcasts or even of my videos that I've made, but I feel like you would be a wonderful resource to be able to talk about that. So yeah, it's definitely I figure you're definitely the person to talk to about this. So going back to your academic history, so learning about Michael Bailey. So is that what kind of piqued your interest in? It's what's this autogynephilia thing?
It was, yeah. I remember when I was trying to figure out where to take my life after finishing my undergrad, I actually reached out to Mike via email from Australia, and he was kind enough to email back and sent me through a copy of his book. And that was the first time that I'd been exposed to the idea. So this would have been back in 2008 or 9. And, I guess I feel I had 2 major periods of revelation with AGP. I think it was the first time that I heard about it, but then it kind of, I kind of slotted it away in my mind. And it wasn't until I was doing my postdoc and started to work clinically again and was starting to work with AGP clients that my second awakening occurred, where I became quite passionate about how this information could be used to better support young people and young adults and older adults who had this type of gender dysphoria. And that's, I must say, when I kind of get my mind stuck on something, it really goes down a rabbit hole. And I'd say probably for the best part of the last decade, it's most of what I've been thinking about. But and certainly now it is.
Oh yeah, I mean, by all means, it's like AGP is definitely a rabbit hole, because I discovered it about like a couple of years ago, I guess. I mean, obsessed maybe like too strong a word, but yes, it's like, because, oh my God, it's like I started reading like, like Ray Blanchard, Michael Bailey, Anne Lawrence, like, oh my God, this explains who I am. It's like I was already about a couple of years already into like my hormonal transition. I'm feeling fine so far, but up until that point, I just thought of myself as like a lesbian born in a male body, which still for the most part is true, because I am gynophilic. But it's like, oh my God, it's like the experiences, like the narratives, especially like from Anne Lawrence's book, Men Trapped in Men's Bodies. It's like, oh my God, there's actually other people who feel this way, like just like me. It's like, and as you said, I mean, as I mentioned earlier, you can attest, it is like a very interwoven, tight-knit community. It's like, I mean, out of the blue, I decided to email like Anne Lawrence, even though she's retired now, but her email address was still like on her website. So I emailed her, sent her very nice letters thanking her. But I also told her, well, I'm, as a self-aware and very proud autogynephile, like I wanted to like be directed toward academics or universities, possibly where I could avail my resources as a self-aware AGP to work with them. And she was very gracious enough to respond to my email, and she gave me put me in contact with Kevin Sue, his email information. So I emailed Kevin Sue. Again, he was very gracious to respond, and that was about a year and a half ago almost, and we've been in touch ever since. And through Kevin, eventually I learned about you, and now you're on my podcast. So yeah, it's almost like a very tight knit family. It's like once you kind of like find one person, that kind of just automatically kind of leads you to like it's like a tapestry. It's very tightly interwoven. It's like, and because of my videos, what I've done, I've had the pleasure of meeting like so many like wonderful autogynephiles, some already aware of who they were, others who felt like that, because of my content. I mean, I'm not patting myself on the back, but they've told me that because of my content, like they felt like, oh, somebody was finally being like proud and self-aware of who they were, like help them kind of like not feel ashamed or stigmatized about who they were as well. So it's like, I mean, between what you're doing, like what Kevin Sue, I mean, what Anne Lawrence, Michael Bailey, Ray Blanchard, Magnus Hirschfeld, all the pioneers before us as well. We're just like, we keep like like laying this path. I mean, the path before us has already been established. It's not going to be overrun with weeds, but it's up to us to keep like kind of cutting the swath with the machetes through the forest and paving the way and making sure that road does not become overrun with weeds. And it's like a wide enough space where we can all walk side by side and in unity as a family here, hopefully. So yeah, it's like
I love your metaphors, Christina.
Oh well,
I love the idea of clearing the path, and it's not going to grow over behind us.
Yeah.
And I loved you talking about the long history of this type of gender dysphoria and documentation of this type of gender dysphoria, because there's a wonderful paper by Ray Blanchard which I'm sure you've read, where he talks about the history of autogynephilia, obviously not described using that particular term in the past, but from Hirschfeld's initial observations of different types of trans women, and obviously Hirschfeld wrote a book on was it the erotic motivation to transition. This is the best part of 100 years ago, and I think one of the difficulties, I think there's been a number of difficulties that have converged to make clearing the path to understanding oneself and making this knowledge available and acceptable to the community. There's a number of issues that make it hard, and I think I think the major issue at the moment, obviously, is the fact that this research and your podcast and the work I do is occurring against a backdrop of forces who are very anti-transgender folk, and particularly when it comes to transgender youth. And so I think often when we're having these conversations about trans, we are preoccupied with the optics. How are these people that might be against trans people accessing gender affirming care going to use what we say to harm this community, or to try to make it harder for folks to access care? And because autogynephilia is, has a sexuality component, and because as human beings we tend to become quite hysterical and puritanical when anything to do with sex is mentioned, I think that there has been an intuition amongst many trans people and researchers and clinicians that potentially this idea or this concept is not safe outside the clinic, that if the general public was to know about it, maybe at least in the short term, that they might have less favourable views of trans women. Now, I'm not sure if that's true from my interactions with parents where I have discussed this phenomenon, where typically I've actually seen that it's led to greater acceptance of their children. But I think that is the fear. And I think then there's a second thing that makes it very hard to clear this path. And so if we get away from the politics and the need to put out narratives that we feel aren't going to endanger trans people, I think the second thing is that erotic target location inversions are really counterintuitive, and they're hard to get your head around. And there's huge number of ways that they can be misunderstood. I'll give you an example. A typical way that clients, when they first might hear about the concept, will understand it is that you're saying that autogynephilia implies that there is only a sexual motive to transition, and that there's no gender dysphoria, and that it's just a fetish. Now, nobody who's ever written about autogynephilia or talked about it sensibly from a place of knowledge has ever characterized it as such. But I think that that is how many people in the lay public, including many trans people, probably understand it when they're first presented with that. And I think that that's something about the fact that, look, the concept does, you refer to this type of this type of sexual orientation and gender dysphoria using the same term, autogynephilia, and it's possible that we need to, more carefully distinguish when we talk or inform our audiences when we're talking to them in academic papers and elsewhere, that what Blanchard said early on, and which is that the autogynephilia is usually the thing that leads a person to first strongly feel compelled to dress as a woman, or to, the sexual motive to have sexual fantasies in the female role. But the gender dysphoria and gender identity are kind of emergent phenomena that can grow out of that. And I think that's important for many folks to know so that they can understand that this sexual orientation and the gender identity that grows out of it can't be reducible to something like a sexual fetish.
Oh yeah, I mean, well, we were talking about analogies. Well, I mean, this is an analogy I also use in one of my prior videos to make people understand. It's like, like for example, you have like a black hole. We've all seen science fiction movies. We know what black holes are. These stars that collapse in upon themselves and all that stuff. Is their gravity. Well, I liken the phenomenon of like somebody who has like like a testosterone-induced sex drive, like myself, and a biological male who's an autogynephile. Yes, so you've got this testosterone-induced sex drive within you. It's just pumping through your system. Because if you got testicles, you've just got it going through you here. But myself, for example, I was never happy having a male-induced sex drive, a testosterone-induced sex drive. I never liked that. I mean, from a very early age, I just my body kind of compelled me to self-pleasure, but it was like forced upon me as like a biological imperative. But I never liked it. So from a very early age, I embraced celibacy and like discipline. I got into religion, a lot of like meditation, to like suppress it and not give in to the temptation. I stopped cross-dressing at a very early age because I didn't like the fact that once my puberty kicked in, it became like there was like an erotic component to it, even though I had started cross-dressing since the age of 5. And at that time, at the age of 5, it wasn't an erotic component. But once I went on hormones, I started hormone replacement therapy, and at the age of 47, the main thing I wanted to do is, besides feminizing my body, was to eliminate my male-induced sex drive. So what happens was, going on hormones, one of the first things that estradiol does, or estrogen, is it reduces your testosterone, and consequently, it significantly reduces your male libido. And so what happened was, my male-induced sex drive was like this star going on the HRT, the hormone replacement therapy, basically caused my male-induced libido to collapse. And like a star that collapses in upon itself, you no longer have any mass, but you still have this gravity that's left. It's this very intense gravity. So my male libido collapsed, which is like the star collapsing in upon itself. But the desire, the love of wanting to live as a woman and present as a woman, that was the intense gravity that persisted long after the actual star itself collapsed. So it's like,
that's a beautiful metaphor.
And yeah, well, I mean, it's like, well, thank you. It's like my mind just works in metaphors. I'm very abstract that way. But it's like, but yeah, it's like basically, it's like I try to get this across to people. It's like, yeah, so a star can collapse in upon itself, but its gravity remains. That's the most powerful force about it. Just like with me, my male-induced libido collapsed. It's gone. I mean, but my desire to still live as a woman persists. That was the most powerful force. It was just that the testosterone was kind of clouding my brain and giving me these unwanted sexual feelings that I never wanted. I never asked for. I didn't ask for a male puberty. Ask the overwhelming majority of autogynephiles, they'll tell you the same thing. They didn't ask to masculinize their bodies. They didn't ask to have like these sexual feelings, but it's just like, it's almost like a curse in many cases. So it's like, and like they welcome going on hormones because it does kill their sex drive. And that's when they realize the fog gets lifted from their brains. It's like, no, there's pure distilled essence of literally autogynephilia, love of oneself. It's called love of oneself as a woman. It's not called lust of oneself as a woman. It's love. And it is now, I mean, yeah, I have like the testosterone levels of a cisgender woman because I've been on hormones now for like almost 4 years. And like I fully transitioned. I live fully as a woman, legally, socially, and I present, I wear makeup, women's clothes, but that's because my social role as a woman. But I don't get like an erotic thrill out of it. It's just like, no, it's like I take aesthetic appreciation. Oh, okay, yeah, I look nice, I'm presentable, I can go out the door. But it's not, there's no like sexual thrill with it. I mean, all of my life, I had like a very, very low libido. I mean, to this day, I mean, it's like I feel like very awkward about like sexuality or having sexual feelings. But I mean, it's more like I have like romantic feelings basically. But yeah, it's just like the gravity persists even though the star has collapsed. So yeah, there's another metaphor for you. So
I love that metaphor. If I can steal that one from you, I would like to. I'll always, I'll attribute it to you, but I really like it because that is one of the, paradoxes that many folks struggle with. And I think it comes from a misunderstanding of what is at the core of the desire to transition in an AGP folk. I wanted to put a pin on two things you said because I think they're critical. And I wanted to ask your opinion on whether or not you think these might be maybe amongst the two prime reasons that trans women who might meet the AGP profile, as well as those who know them deeply, might resist or feel that autogynephilia doesn't explain them. The first was your attitude towards your sexual feelings generally, i.e. your male sex drive, and your attitude towards being sexually aroused when you thought about being feminized or having female body parts or cross-dressing. Because I think many lay people think that if we're going with that AGP's transition because of a fetish, seem to perceive the transition as some way of actualizing or indulging in the most intense form of sexual satisfaction that one could engage in. Now, that, at least from my observations, doesn't capture the AGP clients I see, and I think what is much more common is that relationship to sexuality and to their autogynephilia that you describe. They don't like it. They don't like their male sex drive. In fact, it's the source of a great level of distress, often as soon as it emerges at puberty. And they also don't like the autogynephilic sexual arousal. They say, in fact, one of the things that violates my image of myself as a woman or feeling valid as a woman are these annoying erections or feelings of arousal that I get when I cross-dress. And I desperately want to get rid of those. And that's one of the reasons that anti-androgen medications or estrogen is such a godsend, because it helps me be able to live as a woman without the distress of my male sex drive or autogynephilic sexual orientation, consciously coming into my conscious awareness. Is that? Yes, and I just very quickly say the second reason I think that autogynephilia is commonly understood doesn't feel to many trans women like it explains them, and that's because by the time they have transitioned and have been on anti-androgens and estrogen, or have been on estrogen and had sex reassignment of some type, that autogynephilic sex drive that characterized their adolescence is substantially reduced to the point that it might not, as you said, be a feature of their day-to-day routine. And so at that point, to imply to them that their reason for going out into the world as a woman, or insisting that people use feminine pronouns to describe them, has nothing to do at that point in a proximal sense with sexual arousal. And they accurately resist certain representations of autogynephilia that might be thrown out there by certain politically motivated folk, which imply that, as a 40-year-old trans woman with an AGP past who's now been transitioned for 10 years, when they put on their feminine clothes in the morning, it's purely sexually motivated, because that doesn't accurately describe where they're at. And so I think those two things are reasons why there's a lot of understandable resistance within the community, because the concept, as understood by trans people and the general public, doesn't accurately describe them, even though if we understand AGP as specialists do, it actually, their experiences are entirely keeping with that AGP gender dysphoria pathway.
Well, I mean, in my case, is like where I am now is definitely a different place than where I was before I started HRT. Of course, because of the fact that I no longer have like testosterone coursing through my system, feeling a sex drive. But I mean, nevertheless, I mean, I still identify as an autogynephile, nevertheless, because I did feel, sexual arousal at the thought of being a woman because of the testosterone. So it is. I just, on a prior podcast, I had like Phil Illy on. We talked about auto-heterosexuality, which is basically, attraction to oneself as a woman. So that's what was fueling my fantasies. It's like my fantasy. I mean, when I did have like, fantasies, to self-pleasure myself, I was never like involving like another person per se. I mean, even though I'm gynephilic, I never really fantasized about like making love to like a woman. It was more about just like myself being the only protagonist, is like looking like a woman or feminizing myself as a woman. So yeah, it was just me. That was like, and also I do fit a lot of like the characteristics in my childhood of like an autogynephile. I mean, all my life I've been gynephilic. I mean, I have had like, meta attraction fantasies, which people who are aware, it's like also known as like pseudo bisexuality. I've had a few of those, but they were never like the primary component of my fantasies. It was always like myself. But yeah, I am, in the real world, romantically attracted to just, gynephilic, to either cis women or trans women. But also as a child, I mean, I wasn't all that effeminate. I mean, I was never like read as being effeminate per se. I mean, yeah, I was like bullied and teased in school, but it wasn't because I was seen as being effeminate. It was just like I was like this weird kid who like was socially awkward, never really fit in with other kids. I was a loner, and that's kind of like where I developed like an outsider status. But I was never really particularly effeminate. I mean, I was fine being raised as a boy, being perceived as a boy. I played with boy toys. Yeah, obviously my parents saw what was between my legs, and I was given the stamp on my forehead, male. Okay, and I went with it. I never rebelled against my gender role or my gender identity. Yeah, I cross-dressed, but aside from like the cross-dressing, there really weren't any. I mean, I wasn't hyper masculine either, though. I wasn't into like rough and tumble play. I was never into sports. Never I had like an interest in guns or joining the military or bodybuilding or hyper masculinizing myself. But I wasn't hyper feminine either. I was more like I guess you would say like a middle of the road male. I was very bookish. I was very much into like reading, like arts and culture. I kept to myself. I did feel like more comfortable in the presence of women. Well, this is because of my family background. My father's job kept him away from our home for most of the year. He was in the Merchant Marines. He was sailing the world all his life, all of my childhood. I rarely saw him, just when he would come home from his trips overseas. So I was raised by my mother and my aunt, her sister. So I was around women all the time. So yeah, I was in a house full of female clothing. So yeah, as a 5-year-old, I discovered my mother's and my aunt's clothing. Oh, I was like, I just was naturally drawn to that. I was very close to my mother's side of the family, lots of sisters. So again, plenty of aunts, very few uncles. My favorite playmate as a child was like my female cousin. She was a bit of a tomboy, but so we kind of fit each other perfectly. Basically she wasn't exactly gender conforming. I was more of like a middle of the road, not hyper masculine. So I was happy playing with her. So I think in my case, Dr. Morandini, it was an equal case of me like rejecting masculinity and as much as running towards femininity. So even though I was kind of like rejecting masculinity, or I wasn't exactly comfortable with it, I still wasn't hyper feminine either. I mean, it's like, so I mean, it's very complex. It's like I never thought of myself as a girl, but like looking back in hindsight, was like, well, yeah, I was never that close to my father. I was very close to my mother and my aunt. So yeah, it was like embracing. Maybe there's like some Freudian things floating around as well. Too much attachment to the mother, perhaps, or whatever. But I mean, it's just like, yeah. As an adult now, I was just like, yeah. I felt very comfortable around women. But I mean, and even though I had like some male friends as a kid, not that many. Yeah, I never really engaged in like very masculine play. Like I said, I wasn't into sports or the guns. Never into bodybuilding or the military. More like middle of the road, basically. But
Yep.
not very feminine. But yeah, like it's. I'm sure you've heard like similar narratives to like for your patients as well. But
Yes.
I mean, we're not typical males. I mean, even brain scans have shown that
Yes.
while our brains are not the same as like, homosexual, transsexual males, or cisgender or heterosexual males. But yeah, we're like, I in my first video I call us like mutated male heterosexuals in a way, because it's like, yeah, we're sort of male heterosexuals in the sense that we're gynophilic, but we're also have like this inverted attraction to ourselves as women. So it's like, yeah, I don't know. This is why you and Dr. Sue need to continue your work and keep studying us, because it's like, I want to know like what's going on. It's like, I want to understand myself better.
And you and folks like you deserve that. And I think that it is tragic that self-understanding has been so interrupted by politics of all types, because I think folks who might have politics that we might admire in the sense that they're pro-trans but don't like AGP, either because they perhaps because they feel that it might not go down well strategically. Sure, in the short term, that might be true, but long term, by getting in the way of AGP people understanding themselves, medium and long term, they could actually be causing quite a lot of harm. And so, look, I wanted to follow up, because this might be a good time for us to start to talk about, you talked about your childhood and the onset of your AGP, and how, correct me if I'm wrong, you started to cross-dress, and you found yourself compelled to dress up in women's clothes, and yet at that point it wasn't explicitly sexual. Is that right?
Oh no, yeah.
Yeah.
No, it was more like kind of like I got like a very happy feeling, like a warm, fuzzy feeling, just like wearing like my mother and my aunt's clothing. Yeah, I mean, I did like, yeah, I started at the age of 5. So what years before my puberty kicked in? It's like, I mean, I've been like trying to rack my brain. I don't remember like getting erections as a small child. It was just like, it felt nice. It was just like,
Yes.
I was just like drawn, as you all know, there's various categories of autogynephilia. I was what you would call, transvestic autogynephilia. It was like clothing. It's just like, it felt nice. I don't know. It's like me. I just like, when I put on the clothes, it felt nice. And even though, like I said, I wasn't particularly gender dysphoric at that time, I liked wearing those clothes. It's like, and it just was like a very warm, happy, like fuzzy feeling. It was like a sense of like attachment. Like I said, I mean, as a child, I was very close to my mother. I mean, so it's like, so it's like, I don't know. So maybe it's like, it's almost like a sense of like bonding or like love, as well. But yeah.
Look, here's one of those common misunderstandings that certain people who could be listening to our podcast might be currently engaging in. And that is, people who don't have autogynephilia find it very hard to imagine that one could have a feeling like warm or fuzziness or attachment feelings or sexual feelings to clothing. And they likely are going to project onto your experiences an experience that makes more sense to them, or an experience that has been true of them. So I often hear clinicians and others who are more type 1, so highly gender non-conforming children who would present as, let's say, tomboys. They might hear the narrative of an autogynephilic trans woman recalling her childhood, and they will imagine that when she talks about feeling warm and fuzzy or whatnot, wearing women's clothing, that maybe she's referring to that in an embellished or metaphorical way in describing just how right it was to be able to present in clothing that matched how gender non-conforming they were. But it turns out when you know about this, and which unfortunately, many clinicians who work with gender diverse folk don't know about this, you are not referring to this metaphorically. You're describing emotion, a strong emotion that was elicited by dressing in these clothes, not just because of it aligning with some frustrated gender non-conforming behaviors that you had, but rather there was something about embodying feminine clothing that triggered in your brain a really positive feeling, which in adolescence would become a sexual feeling.
Yeah, and the thing is as well, like Dr. Morandini, is it wasn't just like the warm fuzz, literally the warm fuzzy feelings of wearing women's clothing. It's like, even though like when my puberty did kick in, like I said, I wasn't happy with the sexual aspects, but I just accepted, okay, well, I mean, my mother caught me when I was 13 wearing her clothes. She had a very homophobic reaction. At that time, she still to this day doesn't know what trans is. So she just figured, oh, my kid's wearing women's clothes, he must be gay. So she went off on this homophobic rant. She was not pleased. It triggered like all these negative emotions in myself: fear, shame, disgust, self-loathing. So it caused me to stop cross-dressing at a very early age in my sexual development. Like I said, I stopped when I was like 14. So because I figured, well, I can't cross-dress anymore, and I am attracted to women, I just, in my mind, justified, well, I'm not a woman. I looked at my body. I looked at what was happening to my body with puberty. Well, let me try to just be like a quote-unquote regular guy and see if I can connect with women. But all my life, I mean, I've just been like very awkward and shy around women, even though like I practically just idolize women, always just like, put women like on a pedestal. They've always been like a subject of like awe and like respect and love for me. I could never connect with them to be able to like chat them up, get their numbers, go out on dates, much less have sex with them. So it's like, I just kind of viewed them like from afar. Like I was some kind of like worshiper and they were like a goddess, basically. It's like, oh, women, oh, I wish I could talk to them, but no, I'll just admire them from afar. So I had like a very atrophied and frustrated and like stunted sexuality throughout my most of my adult life. It's like I wasn't dating women. I wasn't having sex. I was, because I was celibate, I imposed a celibacy upon myself. I wasn't expressing myself by self-pleasuring either. So I just bottled everything up. And I just felt like such a freak. It's like, what's wrong with me? It's like, I'm attracted to women, but I can't bring myself to interact with them. I didn't have any friends. I cut myself off from people. I was afraid of being close to people because I thought if people get too close to me, they'll see something about myself that I don't want them to see. I knew there was something I was hiding, but I didn't know what it was at that time. But I knew, like, no, if you get too close, you'll see what it is I'm hiding, and I don't want you to see that. It's mine. Whatever it is, this thing I'm hiding, it's my secret. You can't see it. So as a result, I just cloistered myself from the world. And it wasn't until like, when I had like a series of panic attacks in my late 30s that I realized, well, these feelings I'd had for so long were finally coming to the surface like a volcano erupting, and I had to deal with them. And in my 40s, I'm 51 now, but in my early 40s, I started to kind of process these feelings, and that's when I kind of realized, okay, I am trans, in the sense that I finally realized, well, yeah, I acknowledged that what gave me comfort in my youth, my autogynetic fantasies, I embrace that again. So I'm kind of a bit unwillingly, but as a safety valve to express my sexual energy, I again started self-pleasuring. I mean, yeah. So, and this led to me having autogynetic fantasies, kind of opening the doors, that were the floodgates, and that allowed me to kind of like fully process. It was sexual therapy, as bizarre as that may sound. Because through my fantasies and allow myself to self-pleasure, okay, I need to do this, that testosterone is in my system, it has to come out. Okay, And I did it through my autogynephic fantasies. I realized, okay, without knowing what it was at the time, this was like 10 years ago, I was AGP. Yeah, and
wow.
then when I was like about 5 years ago, I finally took the plunge and I started cross-dressing again after like over 30 years. But I didn't want to mix the two things, having sexual feelings and being cross-dressed. So yeah, I would get like sports tape myself down to avoid any like unwanted physical reactions. And I like look at myself in the mirror, admire myself, and I'd get those warm, fuzzy feelings because I was taped down. I wasn't, yeah. The last thing I wanted to do was like self-pleasure while being dressed. But I would look at myself in the mirror, take some pictures. Like, okay, I reconnected with like my childhood sense of wonder and comfort wearing women's clothes. But
and what you seem to be describing there is, by taping yourself down in that way and trying to avert attention from that part of your body, you're really trying to focus in on that other category of feelings that Anne Lawrence has written about, right? Those attachment-related feelings of warmth and comfort and security and relaxation that is part of this experience. That was the part that was much more fulfilling and that you felt comfortable with.
So yes, I mean, once I started cross-dressing again, I was basically reconnecting with my childhood, like the warm, fuzzy feelings again. And yeah, it just like, and I did that for about a year, for like 2018, 2019, and about a year of just like cross-dressing again. I would look at myself in the mirror and I saw like this wondrous world that I could enter into. It's like, okay, I was pretty much a failure living as a cisgender heterosexual male. I mean, at that point I was like 47, no girlfriend. I mean, no prospects of ever marrying or having children. It's like, well, I tried playing by society's rules. Okay, I'll try, based upon what was between my legs, living by those social mandates. And I realized, well, no, this isn't feasible. It's like, well, okay, what if I did transition? Like, what I mean, what would happen? So, I mean, what would I have to lose? I figured, well, so at that point, I consulted with a doctor who specializes in trans healthcare. Talked to her. I mean, asked a ton of questions, of course. And after about 6 months of meeting with her, I started HRT in the 2019, August of 2019. So almost 4 years. And yeah, once my sex drive went away, I realized, well, no, I like how I feel. I liked not having like a male-induced sex drive anymore. My body was starting to feminize in ways that were very satisfactory to me. I liked it. Since I started 4 years ago, Dr. Morandini, there's been no regrets. It's like, I like how my body is feminized, but there are still aspects of myself that as I got older, especially in my 40s, my gender dysphoria did start to kick in. I really started to hate aspects of my physical masculinity, especially my face. So I mean, I realized I could live as a trans woman, but I would definitely not be passable, because like my face was very masculine. And so I figured, well, no. So thankfully my health insurance did cover like facial feminization surgery, FFS. I had various procedures to like feminize my face as much as possible. So what I wanted to do is I was a realist. I realized I can't erase every single physical manifestation of my puberty. That's impossible. But I can reduce significant aspects of it that are causing me dysphoria, in my case, my face. So I had procedures to feminize my face. I did electrolysis, and I got to a point where I started living androgynously. I was still socially male, hadn't changed anything. I hadn't told anybody I was coming out, but I was dressing androgynously. I had long hair, I had earrings. I wasn't wearing makeup, but eventually I reached a point where I was going out in public, and without me telling people to do so, they were starting to gender me as female. It's like, oh, without me telling people to do so, I'm being perceived as female. It's like my dream was starting to come true. Yeah. Oh, I was over the moon. I was like euphoric. It's like, I'm not telling people to do this. They're just doing it of their own volition. It's like, oh my God, my dream is starting to come true. People are gendering me just as female. It's like, okay, maybe I can finally do this. And even if I don't pass to some people, if I pass to enough people, that would be sufficient. Because I was afraid of like societal ridicule and disdain and what that would do to me, because I'm a very sensitive person. I'm very thin-skinned. I'm an INFP personality, so it's like, it's like I'm very introspective and I kind of keep my feelings to myself. But it's like, okay, if most people will allow me to do this, and they'll gender me as female, why not? So I took the plunge. Last year, I socially transitioned, and I have no regrets. I've got a new job where nobody knows me from my past life. I'm just living, as a female, 24/7, 365, legally, socially, and I'm so happy, Dr. Morandini. It's like, I feel that in my case, I truly was like severely, woefully ill-adapted to live as a male. I feel like living as a trans woman, I fully embrace, like femininity, like female vibes or body language or what have you, female attributes or qualities or things that I attribute with femininity. It's like, yeah, I'm fully like, not just, in wardrobe, but, body language, demeanor, attitude, personality. That I get that feedback from people that, oh, okay, yeah, they're seeing me as I want to present as quote unquote female, or what's society generally ascribes to femininity, and I'm so happy.
Yep.
I'm so very happy.
I'm so pleased to hear that after tough times.
Mm-hmm. Well, this is what people need to understand. Like, people that are like attacking this. Oh, you're just doing this so like you can like go into women's restrooms and get a cheap thrill. It's like, well, this is a hell of an extreme way to be able to get access to like a woman's restroom, to go on hormones and surgically alter your body and your face and body hair removal just to be able to gain access to like a woman's restroom. It's like, well, no. It's like, that's just a hell of an extreme way to do that. It's like, if a male with an unhealthy sex drive wants to go into a women's restroom, he'll just put on a wig and a dress and he'll just do it. He won't worry about feminizing himself. I'm not doing this. I didn't do this to gain access to a women's restroom. That was like the least of my concern. I just wanted to like get rid of my testosterone. And just kind of basically just embrace this femininity that I've been attracted to my entire life. So, yeah.
And your narrative, thank you for sharing it. Mm-hmm. That narrative is, the typical narrative that I see for the trans women that I've treated over the years, and that is the typical motivation. And I think that's important for people to hear, as you said. And I guess zooming out for a moment, I guess, part of the motivation for Kevin and my survey into the longitudinal predictors of transition and well-being in AGP trans women is about, how can we as researchers and clinicians know which sorts of trans folk or AGPs are going to benefit from transition. And then that speaks to a broader question of AGP is a thing, and I think the best explanation for why it exists is that it is there's a vulnerability to developing an erotic target location inversion, which is there from before birth, and it comes online, and the person gains subjective awareness to it at various points across their life. But I think that these are innate, and there is a serious question that has to be grappled with for people that are against the transition of youths with AGP and adults with AGP, which is, well, it possibly is the case that for many AGPs, perhaps most, if they had it their way and it was socially acceptable to do so, they would be happiest and most fulfilled if they were able to medically and socially transition. And it's very possible that's the case. I guess at the moment, we don't know how many AGP birth-assigned males there are, what proportion transition, what proportion have gender dysphoria, and then what might be the factors that differentiate those AGPs who go on to develop chronic gender dysphoria and have a pathway like yours, where that is resolved through transition, and those who seem to get by okay living in the male role, or at least not medically transitioning? I think that's a big question. I can certainly tell you that when I first started this work, I presumed that there might be more autogynephilic clients coming in who would decide that, all things considered, the easiest path for them was to find a way to honour that part of themselves, but without a medical or social transition, and that they would compartmentalise that, and the benefits, social benefits of living in the male role would motivate them to do so. What I've found, though, at least in the subset of clients that come to clinic, is I can think of very few who have been motivated to pursue that strategy, the kind of suppression, or the other would be, suppression might be at one end of the spectrum, another might be, I tried to reduce feelings of stigma and shame around my autogynephilia, and I express it through cross-dressing privately at home, or maybe socially I adopt a non-binary type identity where I exist in a more non-binary, as a more androgynous state, but without transitioning to the kind of female gender socially or medically. But the vast majority of clients, and I'm talking more than 90%, do end up taking hormones and wishing to live in a trans woman space or trans feminine space. So they might say, well, strictly I feel like, if you quizzed me, I'm non-binary because there's elements of myself that, don't quite feel like I are entirely female, but I'm more comfortable socially if people treat me as a feminine person, and I prefer she, her pronouns over others. So that's the typical pathway, and I'm certainly seeing that in the teens. And if we switch to a moment to kind of gender care, for people listening to this podcast, I'm now talking about how to support a very specific subset of teens. So as you might know, gender dysphoria is not one thing, and there's many different pathways, and these pathways can have nothing to do with one another, except that they can lead someone to experience distress in their birth assigned gender, either in terms of the social role they occupy or in terms of their anatomy, and lead them to wish to pursue social or medical transition. Now, historically, there were two categories of trans people that were studied, and they were childhood onset trans folk and adolescent onset birth assigned males, which would be your category, Christina. Even though when I use these categories, your listeners need to be aware that these are categories with blurry boundaries at times, and I mean that in a particular way. Some AGP clients would rightly say, well, it doesn't feel right to characterize my experience as adolescent onset, and that's because, the glimmerings of my AGP and feminine identity or emerging feminine identity are identifiable from childhood. And, like yourself, age 5, you're aware of it. Now, that means that I need to be more specific than saying childhood onset versus adolescent onset birth assigned male. When I say childhood onset, I'm meaning a particular thing. I'm meaning children who were the most extremely gender non-conforming children, who were birth assigned males, little boys who were exceptionally gender non-conforming, to the point that everybody around them, their parents and peers, their siblings, knew they were not a typical boy, and knew that they were potentially, in terms of their mannerisms and interests and personality, more like a girl than a boy. And obviously that's true with some little AFAB people, little girls who are so masculine from early on. Those around them identify them as very different to other girls, and potentially more like boys in many ways than girls. That's what I mean by childhood onset. And I don't only mean, I should add one thing, not only those that are exceptionally gender non-conforming, but those who start to develop a sense of self in which, when they look at the gender array around them and try to determine who they are, their self-concept develops around their gender non-conformity, such that the little boy develops a feminine or girl identity as a result of, on many of the sliders of gender, being further along the feminine end than the masculine end. And that's what I mean by childhood onset, and that has been studied for decades. And Ken Zucker has, and the Dutch researchers like Thomas Steensma have done the pioneering work in that field. And that's not really what this podcast is about. But there is, a big debate we could go into about the best way of supporting those kids. And then we have the autogynephilic gender dysphorics, who are the more prevalent trans women in Western cultures, who are the vast majority of our adolescent and adult referrals. And this is the group that I want to focus on today. And then we have a different group, in the sense that this is a group that people that have worked in gender clinics for many decades first started to see around the early 2000s. And that is birth-assigned females who are presenting to gender clinics for the first time in adolescence. Often without that extremely marked gender nonconformity that I described before, but sometimes with it. But the important thing is many of them will have started to feel distress around their gender, or start to identify as the other gender or another gender post-puberty. And not much is known about this group. Lisa Littman and Mike Bailey have published some studies on this group, and certainly the existing studies that show the benefits of hormone blockers and cross-sex hormones for pediatric populations are not based on these kids, because these kids are a more recently emerging cohort. These studies that exist are based upon the childhood onset group. Now, it might turn out that these adolescent onset birth-assigned females end up benefiting from medical transition just as much as the childhood onset group, and just as much as the autogynephilic group. But that's not known at this point. And one of the features that I guess would be shared, I think, between the adolescent onset group of females and your group, Christina, would be autism spectrum disorder. We see a high prevalence of autism spectrum disorder in these adolescent onset birth-assigned females who are identifying now as trans guys or as non-binary. So it's possible that there are 3 pathways to gender dysphoria, 2 known, 1 potentially newish. 1 is extreme gender nonconformity in childhood. 1 is autogynephilia, and 1 is neurodiversity. Now, these might not be orthogonal pathways. They might often intersect, such that if you're extremely gender non-conforming and on the autism spectrum, maybe that, you know, makes you particularly likely to experience gender dysphoria or want to transition. Likewise with autogynephilia and autism spectrum, maybe that intersection matters. But certainly with the female assigned at birth folk, I think sometimes we will see individuals who do not have childhood onset gender nonconformity, do not have, as far as I can tell, anything analogous to autogynephilia, but where the core driver of the emerging gender dysphoria seems to be this feeling of, you know, functioning better in the male role because their neurodiversity makes them perhaps struggle with female peer dynamics and the social complexity often required for feminine play and friendships. They might also have interests that are more about things than people, and they might have sensory sensitivities that make them particularly uncomfortable with the changes in their body that occur at puberty, like the development of breasts, menstruation. This is quite speculative now, but I'd even say things like the fact that if you meet some of these kids, their facial affect might be quite dulled, as is typical for, you know, female-born people with autism, and that might mean that in terms of their expression of emotion, it can look a bit more male typical, because it's not as expressive. And so what I'm thinking in some of these cases is that these kids, because of their autism, line up on various dials of gender slightly towards the masculine side. And then in the culture at the moment, the trans identity is an emerging space that people are able to live in and be accepted within. And in this cultural milieu, these ASD, AFAB people might find that this is a place that a role or space they prefer to exist in. So what would be different about this group than our ASD autogynephilic trans girls is that they don't have that strong anchor, which is the, you know, autogynephilic motivation to transition, which is why for this group I'm potentially a little bit more cautious than I am with the AGP teens, who I might feel more confident about supporting with a medical transition. I should say that the third category is not just made up of female-born people who have autism. You do see some very gender non-conforming people in this group who didn't conceive of themselves as boys or non-binary in childhood, but who nevertheless are very masculine and who arguably might feel comfortable or more comfortable living in the male role than female role. And, you know, particularly in this particular social milieu that we're experiencing at the moment. And so, and then I think that there's other subgroups of this adolescent onset type where we will see these are, I'd say, more potentially minority subpopulations of the adolescent onset type, but where it might be more complex. And this is where potentially things like interpreting anything from trauma or diffuse dissatisfaction with one's body or with with who one is, or exploration of identity that is a typical adolescent requirement and task, could be channeled within a gender journey, because maybe that's you know, if we're thinking about a kid, a female-born person who's experiencing distress in their body, perhaps the most visible type of condition that they might see in the media or in the peers might be gender-related, and so their particular dissatisfaction with their body and who they are could get wrapped around a gender narrative. And so now I think maybe we could just talk broadly about gender medicine in teens and some of the controversies, and then I'll try to funnel it towards talking about AGP teens. And so, as you know, your listeners might know, since the late 90s, adolescents or kids or young adolescents who are experiencing gender dysphoria can undertake puberty suppression, which are medications that stop them going through the masculinizing effects of testosterone at puberty if they're a birth assigned male, so they won't develop the Adam's apple or the body hair or the low voice or masculinized features in the body, and would be something that blocks estrogen in birth assigned females to stop breast development or the fat distribution that's typical of females, and menstruation. And so that is one type of intervention that has been used, and typically, the population that the research is based on that shows some benefits of this intervention are childhood onset cases. Secondary to that, and so typically those medications will be initiated around ages 12, 13. And then we have cross-sex hormones or gender-affirming hormones, which is testosterone and estrogen, which are going to lead to those secondary sex characteristics that are desired by trans people. So for a trans feminine person, that's going to lead to the curves and breasts developing and more sparse body hair and softer skin. And in a trans masculine person, that's going to lead to the body hair and the low voice and whatnot, and the masculine fat distribution. Now, those WPATH, World Professional Association of Trans Health, put out guidelines, and they provide recommendations to medical doctors and psychologists about how to do transition and medical care for trans young people. And a new version was put out last year, and that's the 8th edition. And that's what we're following now. And currently, there is no lower age bound for the commencement of cross-sex hormones. So a teenager can access those at any age, as long as they meet certain criteria laid out by WPATH, and that is, that they have marked and sustained gender incongruence, which is a diagnosis that has slightly different criteria to the gender dysphoria diagnosis in the DSM-5 that Ken Zucker was chairing the work or meeting that developed that. It's a different diagnosis, but that they have that, that they are capable of Gillick competence, so understanding the medical risks and benefits of doing the hormonal treatment, including effects on fertility and sexual functioning, and that they're aware of the permanent effects of the medications should they be unsatisfied with the outcomes and decide to retransition back to their birth gender. So the things that they would be stuck with are outlined. They're assessed for other mental health issues that they might have, and there's a requirement that those things are reasonably managed before they are commenced on these cross-sex hormones. That doesn't mean that their depression is gone, but it might mean that if they're in a particularly severe period of depression, so particularly suicidal, that might be managed before they commence their hormones. Now, then a letter has to be written by a medical professional, clinical psychologist or psychiatrist, recommending that this young person meets the criteria to access hormones. And my understanding is that this is how it should be working in the US. And in Australia, that's how it works. Now, the typical age that teenagers can actually access hormones does differ from clinician to clinician. At the public services in and around Sydney, the earliest age would be 15 years of age. For the cross-sex hormones, puberty suppression is started whenever required in order to block puberty. And privately, many clinicians who don't work in hospital teams have stayed with the more conservative 16 years of age as the age at which they're willing to prescribe or write a letter in support of hormones for a kid. A lot of the young people that I see are coming to treatment hoping that they will be able to get a letter from me and perhaps get their parents' endorsement of a medical transition. I left one very critical thing out of the WPATH requirements, and that is that both parents provide enthusiastic consent for the process. And where that doesn't happen in Australia, let's say we have a mum and dad and a trans girl, and dad is supportive of hormones being used at age 16, but mum isn't, and they can't reconcile these issues. It can go to the family court, which is where the court can determine what's in the best interest of the child based on expert testimony. But that very rarely happens. Typically, where there is disagreement that isn't reconcilable, the young person will end up waiting until they're 18, or maybe their parent will agree to a lesser or less permanent intervention like puberty suppression. Or many people think, well, what good would puberty suppression be if someone is 14 and has already gone through puberty? Well, these medications are still used sometimes to reduce ongoing masculinization or feminization. And it's not uncommon for that to happen. So the parent might say, I'm not happy with you starting estrogen yet, but I'm okay with you being put on an anti-androgen medication because you're so distressed about going through another another period of masculinization. And so, okay, so obviously, there's a huge amount of pushback in the United States at the moment when it comes to medical interventions with trans teens. My understanding, and I've just been hearing it from patients and my brief perusal of the media, is that in Florida at the moment, something has been passed that has pretty much limited or outlawed pediatric gender transition. Is that true?
Florida's kind of like the most like extreme example right now. And this is, of course, I mean, not to diverge too much into politics, but Governor Ron DeSantis is kind of like the ogre, the boogeyman right now, like for trans rights in the states. And again, and it's my belief that he's imposing like the will of a very rabid minority onto like a more accepting progressive majority. It's like, I think it's like kind of like stoking fears. It's like, oh, they're coming for your kids are being mutilated. It's like, I mean, that's why I feel like this episode is so vital. I hope it reaches as many hearts and minds as possible, because it's like, thank you for explaining the process here. It's like, yeah, Florida's pretty bad. Texas is also pretty bad. I mean, it seems to be mostly states like in the southern United States, like the Midwest, which tend to be like more like rural, like more like conservative, tend to be as well, like not as metropolitan, not as urbanized. but yeah, but I think it's just like I think people need to understand, like, it's not like, like a kid just goes to a doctor, oh, give me hormones, and okay, here's your hormones, go. Or they go to a surgeon, oh, I want surgery, oh yeah, sure, and they pop them on the operating table with, like, no, it doesn't work like that. It's like in the States, just like in Australia, it's, of course, there is like a vetting process. Okay, well, let's, you have to like talk to, at the very least, like a therapist, or a clinician, a psychologist. Okay, you talk to this person, what's going on, what your feelings, your life history, like
Yes.
your distress, and of course you have to have like a clinician sign off and say, yes, this young person does truly have, like, gender dysphoria. It's not like some passing fad. I'm glad you brought up like the ROGD, the rapid onset gender dysphoria, the biological females, because I mean, of course, I'm not an expert on that, but there is concern that maybe it may be a case of social contagion, or as well, maybe for the young people being so impressionable, maybe they're just kind of like, it's like a fad or a craze, possibly. Because I think what also needs to be stressed here, Dr. Morandini, I know you know this as well, is like there is a difference prescribing testosterone as opposed to prescribing estrogen to young people, because they're both hormones, but they have vastly different effects on the body. I mean, I talked to this with Phil Illy in my previous podcast. I mean, like I said, I'm not an expert on this, but I think it's safe to say that testosterone has like far more like dramatic and far more permanent effects on the body as opposed to estrogen. I mean, of course, estrogen does cause like some permanent effects, but not nearly as much as testosterone. So I would imagine for like an AFAB going to say, well, I want to go on testosterone. Okay, this is my belief that maybe it should be a much more severe vetting process, just because of the fact that testosterone is a much more severe hormone in the fact that it does what it can do to your body. I mean, I know like with estrogen, one of the more permanent effects is like breast growth. Like, for example, you'll develop breasts, and most likely those breasts will not diminish or go away once you stop, and possibly even fertility in many cases. But aside, like, as far as like body hair and fat redistribution, all that will revert back to like masculine parameters after, if you stop it permanently. Whereas like with testosterone, it's like the voice will stay permanently low. You may have permanent hair loss, as well. So it's like, okay, those things. And then if you decide, oh, well, you want to revert back to a feminine role, well, you're stuck with that deep voice and possibly hair loss. So it's like, well, yeah, that's what testosterone can do to you, possibly. So yeah, there needs to be like very thorough vetting to explain to both AFABs and AMABs. This is what these particular hormones will do to your body. These are the permanent effects. These are the not so permanent effects, but and of course, parents should be consulted. I mean, if they're living under their parents' roofs, it's like, yeah, of course. That's why people in the States are saying, oh, you're going behind our backs. You're not taking the parents into account. You're just mutilating our children. Well, like, no, parents should always be, it should be a decision, a triumvirate besides the patient. It should be like a clinician, a psychologist, a mental health professional, the parents, and a medical professional, the doctor, a psychiatrist or psychologist, and the parents. They should all be involved with the young person, working in tandem to secure the best interests of the child. But yeah, this distorted, like, crazy narrative. Oh, you're going behind the parents' backs. You're just pouring hormones down their throat or injecting them, and you're slapping them on the operating table and not even like consulting. Well, like, no, it's just like the most ignorant, like unfounded, like these narratives, basically, that are just like so transphobic and just so hateful. Yeah, it's just so yeah.
And this is what makes working in this space so difficult, which is that one, it can be really difficult to, from a good faith position, try to explore some of the uncertainties regarding gender or the risks with a young person, because most of the voices that they've heard who talk about wanting to make sure one doesn't make a mistake, or the possible long-term negative impacts of these medications, are, potentially activists who are not coming from the position of being a physician or psychologist trying to inform the young person of what's in their best interest, but actually politically motivated people who have waded into this space in order to, like, I imagine Ron DeSantis, I don't know anything about Ron DeSantis, I shouldn't project onto him any particular motivations, but I imagine that, you know, if he's like many other politicians and lay people are interested in this area because it intersects with politics, and you know, if I'm it seems like at the moment the right-wing people, you know, pushing back against the perceived left-wing push to transition kids, and so it's become very polarized and tribal. And I've always disliked ideology myself, and I think possibly working in this space in psychology, in the psychology of sexuality and gender, you become more and more uncomfortable with ideology on all sides, because I like to know things with a level of precision that you don't get when you adopt ideological heuristics that says, you know, this theory is bad, or our tribe says this, and you know, the reality of these situations is always very complex, as you know, you've been talking about, as I've been talking about. And you're right, the reason that parents and clinicians can be more concerned about the AFAB people is that, you're right, the intervention is more permanent and, you know, has broader permanent effects on the body. With my trans girls, I can say to parents, look, it's possible there's long-term consequences of anti-androgen drugs and estrogen that we don't know about. But if we're worried about this kid making the wrong decision at 17, well, the only possibly permanent consequence in the short term is going to be breast growth and infertility whilst your child is on these medications. There is some increased rate of permanent infertility, but we don't know what that is. And certainly it's not the case that somebody takes an anti-androgen and estrogen for a month and they're now permanently infertile. You know, typically that would happen if there was atrophy of the testicles occurring over an extended period of time, such that they're no longer able to create viable sperm. So the risk for a trans girl, in some sense, I think, is potentially more social in terms of the, you know, harassment or bullying she might be opened up to, rather than medical. Whereas talking about a trans male adolescent, that permanent voice change, hair loss, bottom growth, so clitoral growth, vaginal atrophy, ovarian atrophy. These are things that for a trans guy who continues in that trajectory of feeling most comfortable in the male role, not much of a problem. But if it's for someone who is, I mentioned that there might be some subgroups of teens who are on setting at adolescents for whom the picture might be more complex. And unlike with the early onset or the autogonophilic, or even just a very gender non-conforming person transitioning or becoming aware of their identity in adolescence, if we're coming from a place of having more diffuse problems in our bodies, diffuse, you know, discomfort with our social role and who we are, and then jump as a solution, that could certainly be a decision that can't easily walk back. And so it's that subgroup of clients that there is a valid kind of concern about. But I think the problem is that that subgroup of clients is often, I think, by some clinicians and also political types, seen as the majority of clients, or assumed to also be the majority of AFAB, trans feminine clients. And this is something that I have seen with parents. I'm going to zoom into the autogonophilic teens now. this is what it typically looks like when I see a teen who's coming in on that pathway. I get an email to reception from a parent who's panicked, saying, my child's turned 16 and they want me to book them an appointment at the public gender clinic. They want to start estrogen now. They say that, if they don't get access to estrogen, they might kill themselves. Parent says, I don't know what to make of this. This kid was never outwardly feminine. They maybe were a little bit on the spectrum growing up, which meant that they weren't as hypermasculine or overtly masculine as their brothers, but their interests have been mostly around computer games, and they enjoyed being in Boy Scouts, and as far as I know, they're attracted to girls. And I don't know what they mean that they're a girl. They've come out and told me that they're a girl, and that in fact they've been a girl since they were 13 at least. And I'm thinking, what do they possibly mean by that? I've never seen them wearing a dress. I've never seen them use any feminine affectation. I've never seen them wear cosmetics. They don't have any friends that are girls. The only activities they like are computer games and coding. And they're at an all-boys school, and they don't want to leave the all-boys school. And in fact, they don't actually want to wear feminine clothes, and they don't want, and I've even offered that I'll buy them some clothes, and they've said they don't want to do that. And they've said they just want hormones. And typically, parents will come in thinking that their kid has been converted to this identity by some online radicalization. Maybe my kid, got caught up in some Reddit forum or Discord group, and they convinced them that they were trans, because that's the only explanation that seems to make sense, given this coming out of nowhere with no gender nonconformity and no apparent prior history of gender issues. And that will mean that often this is the group that I see parents feeling least comfortable in allowing to access hormones, because of how surprising the onset is, and how the young person seems unwilling at this point to socially transition in order to kind of give it a go in the real world. Now, this is a case where I find talking about the autogonophilic pathway to gender dysphoria really helpful, because it's the only theory that explains what's going on with these kids. And often in the assessment with the young person will unambiguously describe AGP feelings. And I will sometimes put it to the young person that, look, my feeling as to why we can't have an open family discussion about where to from here, that includes hormones being put on the table, is because your parents lack a conceptual framework to make sense of what's going on for you, other than that they've been converted to some radical online community, or that the parents might think that there are, underlying mental health issues, which there very well can be, but which are actually causing the desire to be a woman. And those underlying issues might be, in the parents' eyes, their autism or their depression, and the parents might formulate that the kid is identifying as trans because maybe that's a way that they feel they'll be able to fit in with some kids at school, or the kid wants to attribute some of their difficulties to trans because it's more of a valorized and acceptable explanation than perhaps being autistic or something else. Now, when I asked the young person if they'd be willing for me to share this frame with the parents. I'm mindful that, just like I described to you before, the first interpretation parents often have is when they hear the word autogynephilia, and I explain it to them that this is just some fetish thing. It's not that important. Why can't the kid just find a way of managing it other than transitioning? But I've found that if I explain it in particular ways, or I'm very sensitive to bring the parents' awareness to the history of this term, the fact that if they Google it online, they'll see a lot of people who are having reactions to what they believe the term refers to, not actually what the term refers to, and that people on the left and right have misused the term. And I say, kind of like what we were saying before, this is the type of sexual orientation, and like with all sexual orientations that exist in birth-assigned males, once they emerge, they're fixed, as far as we can tell. And so your child is going to live with this struggle for the rest of their life in some way. And we don't know what proportion of people with this sexual orientation develop dysphoria and need to transition, nor do we know whether the transition is the best case for every last AGP person. But we do know that this is the typical pathway via which trans women develop dysphoria and decide to transition, and that much of the literature on the benefits of hormones and surgeries come from adult populations who had autogynephilic gender dysphoria. And I have found that it has been remarkably helpful for parents. I've had people come up, parents in groups that I've run, saying, that blew my mind. It now makes sense. I now can comprehend what's going on for my child in a way that I couldn't before. And I think I can understand why it's been so difficult for other clinicians and researchers to wish to talk about this phenomenon in teens, because gender in teens is controversial enough, let alone talking about sexual feelings in teens. But I'm going to now be a bit harsh, I think, but I'll say I think we all need to grow up as a culture and as clinicians, and we need to stop being so puritanical and squeamish, and we need to think about what's in the best interest of the young people in front of us. And I do think that it is a particularly cruel thing to deny parents an explanation of what's going on with the child, which will actually be able to help them develop empathy for the child suffering, as well as be able to conceptualize why gender transition might be a solution to the suffering. Certainly I take a risk when I talk about this, because it's possible that, and it's certainly happened, that people might misinterpret what I'm saying, or could use that word autogynephilia or the formulation I'm giving to try to ruin my career or my clinic, or but yeah, that's a risk one has to take if one is committed to doing ethical work. And at the end of the day, that's what matters. And of course, that doesn't mean thrusting the formulation at the young person or their family in a way that isn't tactful, or a way that doesn't feel out beforehand how they're likely to respond, and tailor your response very carefully so that you minimize any backlash. Now, I would say that in my teens, there have been some where hearing about AGP is a total revelation. They have that light bulb moment where, oh my goodness, that's what that is. That's normal. And some of them have been existing, socially transitioned, sometimes even on hormones, but feeling that they are an imposter trans woman because they have had these sexual feelings about transitioning, and that they have learnt from Twitter that AGP doesn't exist, and and that they've learnt that their feelings are shameful and shouldn't be talked about, and potentially undermine the validity of their transness. And I think that's also despicable, that that's been allowed to persist, and that these people are suffering needlessly because of a failure of clinicians and others to talk openly about this in a good faith manner, because there's a huge weight off these young people's shoulders when they learn that's the typical pathway to transition. The Danish girl, Caitlyn Jenner, all of the high-profile trans women that exist and that have paved the way for you had this experience. You are normal, and it's okay, and this is a valid reason to wish to transition. Now, yeah.
Oh no, I mean, I think the first thing that needs to be done is to destigmatize the term AGP.
Yes.
It's like it literally means, from the Greek, love of oneself as a woman. It's like love of oneself, not lust of oneself, love of oneself as a woman.
Yes.
And I mean, and
yes.
you know, before the podcast, I mean, we were chatting. It's like, I'll bring it up again here. It's like, as a androphilic male, I know you'll appreciate this analogy. It's like the term queer. That was originally used as a slur against the gay community. It was used to like denigrate them, dehumanize them, basically humiliate them. But what happened? The gay community, they took that term, which was originally offensive. They said, oh yeah, you know what? Damn right, we're queer. We're going to put a capital Q on that queer, and yeah, we're going to fly that flag high. They took it, they owned it, they appropriated it, and now it's like queer is like a badge of honor. It's a very life-affirming, very positive term that's used within the gay community, and like non-gays can also use it without fearing that they're offending gay people. So AGP as well. That needs to be taken back by us and say, you're damn right, we're AGP. We're proud of it. We love it. We own it. And like the analogy here, it's like defanging a cobra. You take that venom that was originally used, that cobra venom that was originally used to harm somebody. You take that cobra venom, you use it, and you convert it into a medicine, basically to save a life. So that's what we need to do. It's alchemy. You take something that was hateful, you convert it to something that's life for me. It can be done. A good tree can grow from a bad seed. So AGP.
Oh, yeah. I love those.
Yeah, yeah. It's like that's why I say, hell yeah, I'm AGP. I own it. It's like, oh yeah. It's like, oh, I own it, baby. I love it. There's nothing wrong with it. Or heterosexual autohet. I mean, it's like you said, sexuality is healthy. I mean, this is a healthy expression of sexuality. It's not harming anybody. It's actually saving lives if you're addressing this. But I also think, Dr. Morandini, on what you express, it's also a case of like intergenerational conflict. You have people like boomers. These people who grew up like before the internet, before like social media. And what I mean, even myself, I'm a Gen Xer. I grew up in the 80s, just at the cusp of when the internet kind of exploded and into the public consciousness. But modern AGPs do differ significantly from their older counterparts, because this is a wonderful manifestation of accelerationism. I mean, societal change is becoming further and further much more it is developing at a much rapid pace. Future shock is pummeling everybody on a daily basis here. So it's I kind of liken it as well to I don't know if you've ever read the novel Childhood's End by Arthur C. Clarke.
No, I haven't.
Well, it's a wonderful science fiction novel, but basically it's a case of these children who basically this alien intelligence comes down from the stars basically and sees the potential of these young children to basically ascend to like a higher state of being. So these children basically, they're like basically like in tune with this higher intelligence called the overmind. And the older generations, the adults, they can't talk to these children. They can't relate to them basically because these kids are like attuned, they're on a different wavelength. They end up like ascending to this higher state of being. So the modern autogynephiles, I see them as, I mentioned this talk to also to Kevin Sue, they're like precursors giving birth to the singularity. They're basically, they're like the parent generation that's going to create something much greater than themselves, but it's like this gestalt, that basically that they're attuned to that older generations can't really relate to. I mean, myself, even though I'm AGP, I'm from like an earlier age, like I wasn't self-aware. There was like a lot of shame and stigma to even being gay, not just trans. So I mean, it's like, it's so wondrous for them that at this early age they can talk to other AGPs online, figure out who they are, and before even puberty, go to their parents and say, you know what, I know who I am. This is what's going on with me. I want to go on puberty blockers. So it's like, it's accelerationism is alive and well. It's future shock. It's like, well, unless we all like become Luddites and go back into like the pre-industrial ages, you can't stop the progress of technology, of societal change. It's becoming an exponentially faster and faster process. It's like, yeah, yes, you're having to run faster to keep up, but basically, you know, if you're agile enough mentally, you know, spiritually, you can kind of keep pace with some of these younger generations. It's like I've met many AGPs half my age, even a few who have been in their teens, and even like I'm not exactly on the same wavelength as them. They've embraced me as one of their own. I mean, because they see the positivity I'm exuding and what I've done with my content, and they embrace me. They say, no, you're one of us. It's like, you know, I told them, when you guys take over the world, you know, take me with you. Because remember, I'm a Gen Xer, but you know, I was always on your guys' team. I was rooting for you guys. I was supporting you. But yeah, it's just, people just need to understand. Yes, this is something older generations can't understand. But you know what? Civil rights back in the 50s and 60s, that was basically like a big like sea change for many people. But it came to accept it and see it as justifiable and necessary. Gay rights, you know, women's rights. Again, it was a shock for people that weren't used to like these freedoms being, you know, being, you know, put into the public consciousness, but it was necessary, and now it's just a given. You know, gay marriage up until like 2015 in the States was not a given universally, nationally. Now it is. People have come to embrace it. It's like nowadays, you know, non-whites, women, religious, sexual minorities are kind of acknowledged, embraced in the States. So too now autogynephiles or as well can hopefully are kind of like just the next in line to kind of be like as well, like, hey, we're here, we're human beings, we're not monsters, we're not freaks. This is new to you, but you know, let's have a dialogue and be open and honest, and hopefully, you know, this will cause like, you know, a greater sea change and like acceptance. That's, you know, because it's just another unveiling in this play that is, you know, human existence and technological progress. So yeah.
Oh, I love how you've said that. And you're right. It's hard because this new AGP culture that we're seeing amongst teen AGPs and young adult AGPs is so alien to generations past. You know, you're right. To some degree, that culture didn't exist in the sense that, you know, AGP trans women would come out, if they did at all, you know, typically into adulthood, often after being married and having kids, and so this new group is going to seem so strange and new and potentially worrying because parents haven't seen examples of, for instance, you know, teenage, late onset trans girls transitioning and then ending up, you know, CEOs or doing well in life. So unfortunately, often, you know, they, as parents, will project their fears into the unknown, and their fears will be, you know, gosh, because I haven't seen this unfold in my generation, I guess I can't know whether or not this is going to be one of those positive developments of our culture that's going to stay around because it was the best way that this group of people were able to express themselves, or is this going to be one of those dead ends of history that actually doesn't go anywhere because it turns out not to be good? Now, I guess we're feeling that, you know, this is a culture that actually is giving a space for these young people to exist authentically and in a way that's more comfortable. Yeah, often it is hard for parents not having the data to look back on and say, you know. But one thing that's relevant to this too, you mentioned the difference between the kind of boomer generation of AGP trans women and the current generation, and that accelerationism, and that is certainly true. I mean, that's, wow, like the latency between first onset of AGP feelings in puberty, let's say average age 13, through to average age of transition in the past was possibly on average 20 or more years. You know, such that the person, you know, maybe the average age of transition was 30s or 40s, if we're talking a couple of decades ago. Now, I think the average age is often, you know, within adolescence, the young person will come out. Onset at 13, come out at 15. And sometimes even earlier. And I've been trying to find the time to write up some work on some of the new manifestations that of AGP. And one of the things that it might even shock you, Christina, I don't know, is the population of AGP teens / kids who might be appropriate candidates for puberty suppression. So you wouldn't believe it, but there are situations, I'm not going to go into details because I've got to be careful of ensuring confidentiality, where kids can come out at something like age 12 after having just started experiencing AGP feelings earlier that year. Let's say they told their parents within a couple of months of first having these feelings. And these parents, in certain instances, will be parents who are quite gender affirming. Let's say, you know, let's say that they're you know, where my clinic is in is kind of like maybe, I don't know if it's the Castro district of San Francisco, but it's a, you know, progressive area, and so parents might be okay with this. And there are instances of AGP trans girls going on blockers. Now that's amazing. It's not common. The most common thing is still the kid coming out at 14, 15, 16 to their parents after a couple of years of struggling with the feelings privately. But that's even happening. So now there's AGP trans girls who are going to have all of the benefits of puberty suppression. Now, I should be clear. We don't know the data on, you know, whether that will be on average a good thing or a bad thing. But I certainly know that some trans women like Anne Lawrence have talked about, and you may have heard the podcast that she did with Stella O'Malley, yes, where she said, you know, had I had my time again, I certainly would have wished to have been able to not experience testosterone as a teenager. And
well, I mean, well, she got quite graphic. She said she was seriously considered like actually a self-induced like orchiectomy. It's like, oh, okay, that's hardcore.
Yes, that's hardcore, but it shows how strong these feelings are, and how there are certainly many adult AGPs who, in retrospect, say, "Damn, I wish I could have done something earlier if the possibility was there." And now we're in a generation where it has arrived. There's still the issue of, okay, are there situations where people, you know, might have strong autogynephilic gender dysphoria in adolescence, but which becomes quite manageable to the point of not particularly impairing in adulthood? And, you know, should we provide a bit more time of exploration before cementing a particular outcome? And that this will be debated by clever and informed people, hopefully, in the coming years. But yes, but I would say too, just one other thing, parents will often, because then going back to your culture thing, because parents often haven't been exposed to this newly emerging culture of gender diverse kids, and more specifically the new culture of AGP teens and young adults, they will have concerns like, how will my child, who seems to be mostly attracted to women, ever have a fulfilling sexual or romantic relationship? Now, this is where, again, I don't think that I could ethically provide an informed consent session with a parent if I wasn't to incorporate what we know about AGP, because there we can say, well, one, for some AGP trans women, it's actually the fact that they can only experience satisfying sexual interactions once they have medically transitioned. So, for instance, those who would say, I can't stand to have sex in the male position, penetrating, a wife or a woman. The only way that I can conceptualize having sex is, as a woman, as a lesbian woman. And for that group, it's actually the opposite. It's possible that their capacity to have fulfilling romantic relationships will be enhanced by transition. Although their pool will narrow, sure. Perhaps there won't be as many women who are open to having a relationship with them, although that's changing as well. There's so...
Well, you also have excuse me for interrupting, but you also have like the phenomenon known as T for T, trans for trans.
Yes. Yeah. Bam. And you're so onto it. And this is something that parents don't know and can't conceptualize without this, which, that technical term, gynandromorphophilia, or T for T. And for parents out there, for many trans women of this pathway, their preferred sexual partner in terms of attraction, sexual and romantic, is to other trans women. And this has been studied objectively. People should know about this study. It's a travesty that people don't know about Kevin Sue's research on arousal patterns of autogynephilic cross-dressers and gynandromorphophiles, because it shows exactly that autogynephilic folk often show arousal patterns where they're most attracted to other trans women, more so than their attraction to cis women and cis men. So this is such important information, because a parent without access to that knowledge, and they're trying to, with their understanding of the world, understand the type of relationship that their trans daughter is going to have, and perhaps correctly understands that it's going to be harder for them to have a relationship with a cis woman. Not impossible by any means. Heaps of relationships of trans women and cis women, but without this information, it's so hard for them to feel comfortable moving forward, or just to consider the issue in its entirety with all of the information on the table. So the fact that sometimes transition is necessary to have comfortable sexual intimate lives, and the T for T phenomenon means that, for many of our trans women we work with, they are dating. They have no shortage of dates within the community. And polyamory is another huge feature that I see of AGP trans life. And I don't know if that has to do with the neurodivergence or something else, but that's another feature that parents will often struggle to get their head around, but is quite normal for these kids these days.
Well, yeah. Again, it's just a case of again, it comes back to accelerationism. It's just like it's just adapting. I mean, and people's kids have been diverging from like their parents for decades now. I mean, again, especially since the 20th century. I mean, first you like rock and roll. The kids were into like this new crazy music that was loud and like, oh, what's this rock and roll music? I don't get it. Like in the 60s, you had like the hippies. Then in the 70s, like, like the punk rock and like heavy metal. It's like, it's just like all these, like, again, these are like cultural manifestations, not sexual or gender orientation manifestations, but still, it's like parents like, have been saying for decades, oh, my kids, I don't get them. What's this noise they're listening to? Like, why are they dressed like this or blah, blah, blah. It's like, well, yeah, this is a more like innate thing because it's like gender orientation and sexual orientation, but nevertheless, it's just a case of, again, just the age-old quandary. Oh, I don't get my kids, but if parents love their children, they don't have to understand it. They just have to accept it. It's like, I don't expect non-AGPs to ever understand what it's like to be this way. I mean, this is why I just feel like I want to meet and have connections with as many AGPs as possible because only they can get me. I mean, you're very sympathetic. So is Dr. Sue. I mean, bless both of you. You're doing your best to help us and understand ourselves. But really, it's just like But I mean, it's a case of us like having like an extra sense or having an extra dimension.
Yep.
It's just like, well, yeah, it's like we have like this extra sense that only another AGP can get. It's like, and because I don't know if it's like neurodivergency, but we also seem to have like a lot of the same traits regardless of our generational differences. It's like, I mean,
yes.
Yeah, I mean, a lot of AGPs I know, it's like they'll be like into the same like cultural things I am, like the same type of music, type movies. It's like like as well like just like tastes or some being like affinities. It's like oh my God. It's like yes, I think that's why like they also make ideal like friends and especially like ideal romantic partners. It's just because we get each other. It's like, I mean, really, what do you see in a friend or a romantic partner? What do you cherish about them? They get you. They understand you. Like they're on the same wavelength as you. It's like it's a case of opposites do not attract. In this case, like similarities are the greatest like magnetizing force. It's like so. It's just. I think just kids need to be open with their parents and say, please, I mean, I don't expect you to understand this, but it's who I am. Here's the literature. I mean, or whatnot, but it's just a self-awareness. I mean, AGP is, I don't know, it's I'm sure it's been around for possibly as long as humanity, possibly. I mean, divergency has been around. Yeah, I mean, I'm sure as long as homosexuality or lesbianism has been around, there's probably AGP as well. Just I'm sure that somewhere in a cave, somewhere in Europe or Asia or somewhere even Africa, there's like cave art of somebody drawing like a male, somebody with a penis and breasts.
Yes.
I'm sure there is. Like,
yes.
That's either a GAMP or an AGP that drew that. I'm sure there's cave art that expresses that. I'm sure there is. I mean, and there actually is like ancient art that shows like gynomorphs, like people with like both male and female anatomies. That's definitely like an expression of AGP. So it is going back to antiquity. You can tell people, look, this has been around since classical times, antiquity. Look at these paintings, these statues. It's like that's a manifestation of AGP. It's like again, it's just people trying to like tie people's spirits to their genitalia when it's two different things. It's like, I mean, my mother, she's a very conservative Catholic in her 80s. She still doesn't understand trans, but I use religion to try to get through to her. I ask her, you're a religious person, so like, what to you is more important, the body or the spirit? And she'll always tell me, no, it's the spirit. Okay, why do you think? Okay, that's true, because once you die, the body goes back to the earth, and it's impermanent. The spirit is what is eternal, in religious belief, and what ascends to a higher state of existence. I told, well, that's me. I was born with an XY chromosome body, but my spirit is feminine or gynophilic anyway, autogynophilic. This is what is essentially me. My AGP is what defines me. My body, I can alter it. Yeah, my chromosomes I can't change, but you know what? When I die, my body will go back to the ground and be recycled into the earth. But my spirit, if there's a spirituality, that AGP spirit will, go out into the cosmos and become like just merge with the greater whole. And that's who I'll be. This is me. My AGP is who I am. It's my spirit. So.
Yes. Wow.
Well, I mean,
and
does she?
Does she respond well to that?
Not my mom's a very complex person. She still she doesn't accept me as her daughter, but she still loves me. She's gotten used to me like looking this way, but she's too set in her ways, and her Catholicism has made her too very hidebound to only think in dichotomies male female. But she still loves me. But okay, I mean that's fine. I mean you can't win them all. But I mean the fact that she didn't turn her back on me. Okay, well that's I mean. But again, it's just the older generations are the ones that are going to have the hardest time understanding this. But like millennials, Zoomers, Generation Alpha, they're all like very like, especially with millennials and younger, that's kind of like the crucial dividing line. People like in their 40s or younger are the ones that really get this and can appreciate it, because it's kind of like they've seen it in the culture. They understand it's just like a manifestation of the internet and social media allowing people to be more self-aware. But yeah, like Gen Xers are kind of maybe 50-50. Boomers are much more like conservative, like skeptical or resistant to this. But yeah, the gender generations, my faith is with them. It's like, yeah, they embrace this, and they'll inherit this planet one day, and it'll be a much more like we'll see rainbow flags everywhere, AGP flags, trans flags everywhere, sooner than later. It's my hope. But yeah, it's just it's just
I'm still waiting for the AGPA to be added to LGBTIQ plus A. We need the A because it's so central.
It's kind of like pi. It's like pi is like basically like dot, but after the dot, like it's an infinitesimal series of numbers. That's kind of like how like the gender spectrum has become. It's like a pi equation, like this infinitesimal, and that's fine. That's fine. You shouldn't put people into boxes. NB, asexual, pansexual, AGP, AAP. They're all valid manifestations of human identity and expression. So.
I'd agree with you, and this is a changing culture around this at the moment, and you're right.
I mean, it's just like I mean, we live in interesting times. So.
We do. It's really interesting. I would say you mentioned how AGPs just get AGPs, and definitely I've observed that as well, and it speaks to the issue also of those working with AGPs, to what extent is there value in someone having quote unquote lived experience? And so I'm talking about psychologists and medical professionals, because I agree on a rational basis with what you're saying, that having that similarity both in terms of temperament, histories, having access to erotic target location inversion phenomena makes AGPs uniquely in a position to help others. And the problem is, of course, within the lived experience kind of movement at the moment. Again, I'm concerned about the lack of precision. So it's not so a trans masculine therapist or non-binary AFAB therapist, by virtue of being under the trans umbrella, I guess they have some experience that's relevant to the AGP client, which is they may have experienced the difficulties of coming out to people, of pushback and disrespect when it comes to use of pronouns, and perhaps they've understood, processed somewhat of accessing medical affirming care, and so they have certain type of knowledge that does make them more helpful than someone that doesn't have any knowledge, but also their experience doesn't enable them to understand the experiences of AGP trans folk And I think at the moment, I think they could be as likely to misunderstand or misattribute the basis of the trans teens' gender issues as a therapist without trans experience, because they're going to be projecting onto the teen that maybe the teen has walked a similar path to those who they're familiar with, and maybe their own path, which is being very gender non-conforming and same-sex attracted, or their gender identity being kind of an outgrowth of maybe being a politically active and creative person who also has same-sex attraction or something. But the AGP journey is a very different journey, and I think their intuitions are likely to lead them to wrong conclusions if they're projecting them onto the AGP team. Yes, yes. Anyway, that's another issue.
Well, also like what I find so tragic is that there are many like trans women who are very like hostile to like the narrative of AGP. I mean, they still want to kind of cling to this like this narrative like feminine essence, like, oh no, you know, I didn't transition for sexual motivations or for paraphilia. And what happens is like in many cases, like in online spaces or whatever, or they try to gaslight AGPs into telling him, oh no, you've just been brainwashed by Ray Blanchard. Don't listen to him. He's a bad man. He's a fraud. Or Bailey. They you know, because of like, I mean, I don't want to attribute motivations, but it seems to me that in many cases these women quite possibly are AGP themselves, but they just don't have like the self-love or they haven't processed their feelings sufficiently to accept, well, okay, yeah, I am this, and I did it. There was like a sexual motivation because they were maybe conditioned to feel like, well, that anything that's sexual is shameful or stigmatizing, and so basically they become like rabidly anti-AGP, even though they quite possibly are AGP themselves, and they gaslight these people. Oh no, you're not AGP. No, don't listen to Blanchard. Don't listen to Bailey. They're crackpots. They've been discredited when they're not crackpots. They haven't been discredited. There is a thriving, alive and well AGP community online. You and Dr. Sue are wonderful examples of still current extant, you know, AGP academics. You know, as well. So no, this isn't pseudoscience. It isn't like this is like the Flat Earth Society. It is. I mean, it's like I just like how dare these people? How dare you gaslight? Okay, fine. If you are insecure, you have your hangups. That's fine, but don't project your hangups onto other people who are genuinely trying to understand who they are. These people. I mean, a lot of like these searching, these questioning AGPs, they go online hoping to find answers. They go onto these trans women spaces, and instead of getting like answers, they get gaslit, and possibly they may just be converted to this camp that's preaching censorship, suppression, self-loathing, and like and lack of self-awareness. I mean, it's anti-Gnosticism. Whereas I see myself and other self-aware AGP, we're the Gnostics, we're the self-aware ones, we're the ones with the light bulbs over our head, basically. It's like, so like we're like the light in the darkness. You're trying to like keep this truth alive because it is truth. So
yeah. What you just said then, gosh, that moved me and I resonate entirely. And
it's my neurodivergency. This is how I am. So I milk it for all it's worth. I mean, so yeah.
I love that, and I mean that does bring us to a question, which is, I'm wired a bit like that too, which is, it was important for my coming to terms with who I was to try to understand it accurately-ish. Which included confronting things that were initially uncomfortable, and which I could have, at that point, adopted a comforting yet false community narrative. But the reason for not doing that, I guess, was that sense that I would have always known it was false to some degree. And ultimately, that would have caused more discomfort or pain. And I think there's kind of an analogy to the rejection of, it's not quite as intense, but there's an analogy to the rejection of AGP amongst some trans women, to the rejection of male femininity and gender nonconformity in gay men. And so you might remember that before Mike Bailey was getting in trouble for his research on autogynephilia, he did research on gender nonconformity in childhood and adulthood amongst homosexual males. And, you know, and he and Richard Lipper and many other researchers, you know, showed that gay men are feminine, are on average more feminine than straight men, and that these differences can be quite marked, and that the reason that, and yet many gay men were very upset about that and rejected that and said, how dare you say that we are feminine, or how dare you say that our brains are like women's brains. And it was because you know, they had experienced shame about their gender nonconformity as little boys, and potentially had been experiencing abuse and bullying, being called sissies and whatnot. And they did their best to construct and contort themselves into a position of appearing fairly typically masculine in their gender presentation, even if there was a lot of acting and social modeling that they had to do, and inhibition of perhaps their natural mannerisms, interests, preferences. And so when Mike and others, you know, unearthed that knowledge, it did cause deep feelings of shame in some of these gay men and gay activists who attacked the work as anti-gay, contributing to stigmatization of gay men, erasing gay males' subjective experience of being men. And I can see comparisons between that controversy and the autogynephilia controversy. In both cases, there was something that, because of unfortunate cultural stigma and moralizing, was a deeply shameful part of this young person's experience, and the person developed a defensive response to that part, and that made them particularly activated and triggered when that shame, when a mirror was held up, and that's and look, Anne Lawrence does, I forget which article it was, where she talks about the benefits and risks of autogynephilia as a theory being shared with patients who are likely autogynephilic trans folk. And she mentions that for some individuals, that the feminine essence narrative might be protective. It might not be true, but it is helpful in meeting a set of needs. And those needs might be, look, I really need to not be living in this body. I really need to transition. For whatever reason, I have developed a set of quite fixed beliefs that wouldn't allow me to transition if I understood this as something other than me literally having a female brain, or the autogynephilia having nothing to do with my motivation to transition. And so so she was saying, and I guess that leads me to, give you a question, which is, because I'm mindful of the possibility with some of my clients that, and just in this research generally, that something being true might not in every case lead it to be the most beneficial for the individual, all things considered. Now, my strong preference is for truth, and I couldn't feel comfortable without that as my anchor. Yeah, I guess I'm curious about your thoughts there. Whether you think that it's just we're at a moment where the dam is breaking, and as soon as this knowledge and the science behind it is packaged in a way that's palatable to trans femme people, it will very quickly be taken on as the dominant narrative, and the resistance will kind of fall away. Or whether you always think it will be a minority or a subgroup of AGPs who will be willing to accept the link between their autogynephilia and their trans identity.
No, I definitely see like a generational shift, like the younger trans women, for example, younger trans women. I think the tendency towards them will be at the very least like an equal balance of acknowledging being self-aware AGPs, or at least like AGP neutral, like, well, no, this isn't me, but I don't have a problem with AGP, and not stigmatizing it. Or, but yeah, but like, yeah, these, but like people like the gaslighters, the rabidly anti-AGP folks, those tend to be like the older generations, like myself, or like boomers, who just, like grew up in an age of repression and like heteronormity being shoved down their throats, and like this being hammered into their heads. Well, no, basically, like, it's femininity. Well, also it's also a lot of these. I think a lot of it is like internalized like misogyny, as well, like as well, like being told, well, no, you're a man. Men are superior to women, so why would you want to be a woman? And also that kind of like giving you a complex. Oh no, well, I can't be trans, and causing you like in my case to suppress well into like your 30s or 40s or beyond. So it's like the older you become, people tend to become like more conservative. Not in my case, thankfully. I'm actually more liberal. I'm actually more liberal and progressive the older I'm becoming, thankfully. So yeah, but I think the younger generations are the ones that are going to tip the scales towards AGP acceptance and just like normalizing it. We're like, they're just going to say, yeah, I'm AGP. But I do think most AGPs, the younger ones, they accept the AGP label, but they're not like orthodox Blanchardians. They may say, yeah, Blanchard was onto something. Some of his points are correct, but I think he was off on other things. So it's gonna be like a self-correction where they're gonna say, yeah, we're appropriating AGP, but it's not the orthodox Blanchardian AGP as formulated by Uncle Ray. So I do believe, like, because they're going to like appropriate it and basically mutate it, transmute it, like alchemy, into like this new substance that had like where it was, its ancestor was AGP, but it's going to be transmuted to something like much more like, like you can see like the ancestry, but it's going to be something else entirely. So yeah, so like 21st century AGP is mutating, evolving into something else. Where like you can see like the lineage, but it's not going to be the Blanchardian AGP of the 20th century. Because the people that it's describing are evolving and changing. So you can't have it be static. It is going to be a dynamic, fluid phenomenon, because the people that it's describing are also fluid and dynamic, and will continue to be even more fluid and dynamic the more we progress into the 21st century. But I also wanted to bring back a point where you said about like many maybe homosexuals or AGPs getting into like hyper masculine behaviors, because this is why people sometimes think, oh well, how can you be trans? I'm shocked. I mean, you were so masculine. Like, they were in the military. They had like they were like they bodybuilders. I mean, they work on cars or whatever. They were into guns. They had tons of girlfriends. But a lot of times this is like coping behaviors. I mean, many have self-admitted. It's like, because they were told, no, you can't be a girl. That's impossible. So what they do is, they realize, I have a male body, and it's not feasible for me to transition. And this is like older generations. Many times they think, I'll kill these feelings that are like they're not rational, they're not feasible, they're not logical. And I think the more butch, the more macho I become, I'll just adapt to the body I've got, and I'll just be happy that way. And it's a coping mechanism. I think they try to kill these feelings by, okay, this is the hand I've been dealt with, this male body. Okay, I'll bodybuild. I'll do typical male things. I'll join the military. I'll get into guns. Be into sports, whatever. It's like I'll date lots of women. But they realize they can't kill these feelings. They can suppress them, but you can never like tear it out by the roots and extirpate it. You can't. I'm a prime example of that. I never got into hyper macho behavior. I just kind of withdrew into myself. I just had internalized transphobia. I had internalized homophobia because I am attracted to trans women. So it is same-sex attraction, but I never came to grips with that. So I just repressed. I said no. So I engaged in casual trans and homophobia. I would say idiotic comments, or if somebody said an idiotic comment, I would laugh along or go along to just be one of the boys. Yeah, I never engaged in violence. Thankfully, I never was like violent towards gays or trans people. But I was still part of I was part of the problem. I wasn't part of the solution. But because I was repressing, I thought, well, if I ridicule this, I can make my feelings seem insubstantial, and it'll be easier to get rid of them. But yeah, you can't make these feelings go away. It's just like if you're straight, you can't make your straightness go away. If you're gay, you can't make your gayness go. It's just, you might as well just rip your brain out of your skull and put in a new brain if you want to make these feelings go away. It's like, it's just, so it's like, but this is why people need to understand that some of us, we're not like hyper feminine, but a lot of times these uber masculine behaviors were coping mechanisms to basically adapt to the bodies that we were given by this whim of genetics, basically. But but once these uber macho men, quote unquote men, realize that they're trans and they realize that they have to live as women, I mean, the change is dramatic. Some of them become like quite feminine. It's like they go on hormones. They get like the FFS. And they become quite stunning and very fetching women. It's like, oh my God, it's like they went right from like being the auto mechanic to like a runway model because they discarded this faux shell that was never their true selves. And once they let like this inner autogynephile or this feminine spirit flourish, it's like, my God, it's like it's like stunning. It's like that's the authentic self. Yes. So I mean, that's what people need to understand. It's like it's a coping mechanism. It's like, it's like, because we're told, oh no, you're a male. Okay, well, I tried playing by society's rules for most of my life. So people can't say I didn't try. But I was, you've heard of alpha males. I was an omega male. I was not suited to be a male. I was at the bottom, and I was going to stay there for the rest of my life. Now, I'm not saying that now I'm an alpha female. I'm not. But at least I don't consider myself to be like an omega female either. Right. I feel very well suited to my social strata as a trans woman. Do
you perceive that's a really important point? And do you perceive that feeling like an omega male was purely the result of the autogynephilia, or was it the autogynephilia plus other traits? The neurodivergence, or
I think it was AGP as well as other traits, because I mean, I was very unusual compared to many other AGPs. Most AGPs can at least socialize with women, talk to them, date them, have sex with them, get married, have kids. They can be sociable. They can have friends. They can go to college. Get careers. I think I have other neurological factors that contributed to like my just extreme social awkwardness. Like I said, I could never really connect with women. It was hard for me to make friends. I mean, I chose not to have friends. I isolated. So I just became very solitary, very withdrawn, very much just with very introspective. I just kind of pretty much just like inhabited my own headspace, and I never came out of my cave, as it were. So yeah, I think I have other contributing factors that made me basically just be completely inadequate to live in a male role. I mean, like now, I'm just barely like almost a year.
That's fascinating.
I'm just barely like now a year into socially transitioning, and it's been like almost a year and a half since I made my first videos. So, but within that time, I mean, like I said, I mean, I've started to establish like friendships. I mean, like budding, like budding, like romantic, quasi-sexual relationships as well, encounters. Um, but yeah, I mean, I'm more social. Like I can talk much more easily to people now. It's like I'm not like fearful. And even like around women, it's like I feel like much more comfortable being around women, cis or trans, interacting with them as well. So I'm seeing much more positive results. I'm not the same person I was before transition, and that's the point. You're not supposed to be in the same quandary or in the same gloomy box as you were post transition. Yeah, there is the phenomenon of detransitioners. I'm not denying that. I'm giving them their due. It's tragic that transition was not for them. They decided that they had to detransition. But I'm not even contemplating that. I'm happy to live as a trans woman for the rest of my life. I'm quite happy with the decision I've made. Like I said, I'm not an alpha female, but wherever I'm at now, I'm happy with the social strata I'm occupying. I don't feel like I'm being suppressed or like holding myself back. I think the sky is the limit.
Love that.
I feel I'm free to like make friends, fall in love.
Yes.
I identify as like I have a low libido, so I'm quasi asexual, but
Yep.
but still, nevertheless, within that quasi asexuality, low libido, I've had like encounters that were very satisfactory to me. That were quasi sexual. I look forward to having more of those in the future. So yeah, I mean, it's like, yeah, nothing's holding me back. I mean, I can be likable, possibly lovable to others, but it's up to me for me to put myself out there and be accessible to people. And I have that attitude now of being willing to do that. Transition saved me, just like transition is saving the young people that come to you. That you're saving lives. I mean, many of these kids, I mean, could kill themselves. I mean, who knows? I mean, who knows where I would have been at? I might have ended up killing myself eventually. I don't know. I was in a dark place. So yeah.
I'm always cautious to attribute that sort of significance to my work, only because I often find it's a little uncomfortable when gender clinicians are a bit too self-congratulatory about what they're doing, because when I do it, I must say, because not all the data's on the table, it's often a bit, there's a tortured part of me that says, well, the data isn't there. The data's there for autogonophilia as a phenomenon, and the data that I've seen suggests that transition can be a good thing for autogonophiles. But I certainly do wake up some mornings and I think, gosh, I hope I haven't caused more problems than I have fixed. But that's but again, maybe that goes to the truth orientation. I don't like self-delusion, and I'm not sure, so I don't have the data yet to know, but whether what I'm doing is helpful. But I do think I feel very confident that talking about autogonophilia is helping parents understand what's going on and helping them then support their kids. And I think it helps me provide support for AGP trans girls that I wouldn't be able to otherwise. And so I think that is beneficial. Yeah, but it's so complex. I wanted to mention one more thing before I forget, which is that there's a little bit of a controversy. I know Mike Bailey mentioned it in a recent talk that he gave about do any males, or birth assigned males, experience rapid onset gender dysphoria? And I'm aware that there are clinicians and who are quite knowledgeable and parents of adolescent onset trans girls who feel that autogonophilia doesn't explain what's going on for them and feel that their onset is more akin to what is being proposed to exist in adolescent onset trans guys. So a kind of more diffuse dissatisfaction with being in the male role, feeling like they can't fit in at school, finding a trans peer group, and transitioning more to meet social and emotional needs of the moment, but not autogynephilia and not highly gender non-conforming androphilics. And I would never say never. You know, the world's messy, and I've spoken to people with a lot of experience who feel that this is a pathway. They would typically say it's like a non-autogynephilic autistic pathway, where the young person might feel distress to do with their genitalia or sexual arousal, that the clinician would attribute to autism and sensory sensitivities, not AGP. Now, I sit more on the side of, I have seen many clients who, unless you really knew what you were looking for in terms of AGP, and you didn't come at it with exquisite sensitivity and care over a long period of time, you would never have known about that part of themselves. And I certainly had clients, as have others who I work with, where it emerged well into therapy, something that you wouldn't get in an initial assessment, or even a kind of a 6-session assessment for hormones or puberty blockers that sometimes these kids might get when they go to a public service. So my feeling is that Mike Bailey did an online survey on Twitter. You may have seen it, where he asked, you know, how many of you AGP folk think that your parents were aware of your AGP growing up? And the rates were extremely small, I think single digits. So I could be wrong on that, but it was very small. So that is useful, because it means that the fact that parents don't see it in some overt, obvious way doesn't mean that it's not there. And parents often have a bit of, as do clinicians who don't work extensively with this group, they might have expectations of what they would see. They might think that their kid's going to be, I'm trying to say this in a sensitive way, but like very obviously engaging in cross-dressing and masturbation in a way, or very obviously sexually aroused when dressing in women's clothing or something. Now, you and I know that that's not how this manifests for most of these folks, and that many parents will never get access to that part of the young person's life, except if the parent was to stumble across some clothes that the young person had hoarded, or walked in on them cross-dressing, or maybe saw their browser history was looking at, you know, trans porn or you know, AGP themed porn. So
I want to bring up a valid point, because a lot of like the scapegoat is saying like, oh, these kids, they're transitioning, they're like false trans because online porn made them this way.
yes.
But that doesn't explain the fact that what about before the internet? What about autogynephiles and trans women before the internet? I mean, it's like the internet has only been around like for, say, like a little over like 30 years as far as like accessibility for most households. So what about people before then? I mean, you didn't have like, you know, anime or manga or sissy porn or hypno porn back then. So why did you have trans people or autogynephiles back then? So yeah, I think it's just like a scapegoat. But yeah, I'm sorry for interrupting, but I just wanted to.
No, and I think that is appealing to some parents and clinicians for understandable reasons, because they think, you know, gosh, this whole trans pathway looks really hard. if there's a way in which this is some sort of conditioned fetish caused by sissy hypno porn, then potentially can't we just eradicate that stimuli, and then the kid won't want to transition anymore, and help maybe in addition do some therapy where they practice healthy sexuality, and I think it's appealing, because it suggests that the underlying autogynephilia is not fixed and immutable, but rather can change. So yeah, obvious why some parents would find that comforting. But if we move away, as both of us like to, from the comforting to the real, they're different things. And unfortunately, many things that feel comforting are not true. And I think that the most generous explanation for how porn or AGP stimuli could contribute to a child's transition would be perhaps if occasionally we will see people who don't seem to be aware of AGP feelings until later on, maybe their 20s, they say. Now, is there self-report stuff going on there, or is that actually what's going on? But sometimes they will say, maybe it was because the stimuli that I need to experience autogynephilic attraction is kind of hard to come by in my natural environment. And so it took a while until I saw, for instance, a picture of a trans woman or something, or trans porn, and that, or I saw a image that showed a male being turned into a woman in some sort of context, and that was what alerted me to the fact that I have these feelings. And perhaps if I hadn't seen that for another year, I would have become aware of it some other way. But there was a type of stimulus that wasn't easy to come by that alerted me to having these feelings. Now, that's a different thing to saying the stimuli caused the feelings. So I think that's probably the only way in which the sissy hypno thing might be. It might be a way in which some autogynephiles first become aware of their AGP. Maybe, they were like, oh, I'm pretty much asexual, and and for some reason I like the idea of being a bit more feminine than I am, and then I saw this sissy hypno porn, and that was the first time I had a really strong sexual feeling or something. But
well, also, I think in that online lecture that Michael Bailey said, he said something that was very, very cogent, and to the point. He says, porn like reveals who you are. It doesn't make you who. I'm sorry, I'm misquoting. But
yes.
But the gist of it is like porn reveals what you like. It doesn't make you like a certain thing. I'm sorry. It was something like that. But it reveals what you're into. It doesn't cause this all of a sudden, like out of nowhere, for these feelings to appear inside of you. It reveals what you're into. Yeah, yes. It's like when I was a child. It's like I would see like drag queens or a female in person, because even back in the 80s, you would see sometimes on talk shows or whatever, TV shows, a drag queen or a female impersonator. It's like, oh my God, it's like she's hot. Like involuntarily, I would just go like, oh yeah, like sexual feelings. Like it's like, oh my God, but really, that's a guy. But in my mind I would think, oh, that's a male. Oh, I can't be attracted because I'm not gay. But it didn't matter. It didn't matter that I had internalized homophobia. I still was attracted. But yeah, now as an adult, fully acknowledging their gamp, it's like I can see, I would see that on TV, and it turned me on because it revealed what I was into, like trans women. Yeah. So.
Oh, that amazing. Yes, and it was very clear that you hadn't had any exposure to stimuli that would have conditioned a gamp sexual orientation. It was revealed to you by that stimuli. And I think you also raised another thing that I'd like listeners to know, because this is another thing that parents and clinicians get confused by. You said you went through internalized homophobia, and you also talked about GAMP, and this is common when we see the trajectory of our young people. Often before they come out as trans, they will report a period of questioning whether they're gay or bisexual. And they might even come out to their parents about that. And then they come back to mum and dad 6 months later and say, I'm a trans girl. And their parents, having learnt the dogma that sexuality and gender are entirely distinct things that don't overlap, might say, well, what's the likelihood that my kid comes out as gay and then bi and then trans? Clearly, this speaks to social contagion. But if the parents or the clinicians really had a good understanding of the phenomenon that they're dealing with, this would be expected. And they would have a unifying theory that very neatly explains this very typical presentation. That is, the birth-assigned male starts to have autogynephilic fantasies, and some of those might be meta-attraction or pseudo-bisexual. You know, they're sexually aroused by being a woman, but they're also wondering whether they might be gay or bi because they get turned on by the idea of being penetrated by a man as a woman, or because they're attracted to trans girls with a penis, they question, am I gay or bi? Or just because they get turned on by feminization themes, am I gay or bi? And now they are, and so what's actually happening is they're becoming aware of their autogynephilia. They're using the labels that exist in the culture to try to make sense of it. Unfortunately, those labels are too low resolution to capture what's going on. And then, of course, this type of sexual orientation also has gender implications. And so then at some point, they might attribute the feelings to a trans identity. And yeah, but that pseudo-bisexual meta-attraction, wondering, am I male attracted, calling oneself pansexual or bi, is the typical thing that we see in our young AGP trans girls or questioning folk. And one of the features that clinicians can use to identify this pathway in a young person, if the person's not forthcoming with talking about these experiences.
Oh yeah, I mean it's well also it's also like tragic that there aren't more like mental health professionals that are aware about AGP. In many cases, the AGP patients are the ones that are educating the professionals. It's like in my case, when I was seeing a counselor, she wasn't aware about AGP, but in my very first session, I told her, well, I have AGP. Well, what is that? So I had to direct her to like articles by by Michael Bailey, by Ray Blanchard, by Anne Lawrence. And thankfully, she was open-minded enough to acknowledge this and say, okay, well, this is who you are. Thank you for educating me about this. And she came to understand it basically because I wanted her to like know who she was dealing with. So, and also it was just a case of me like, because I knew that, there is like this massive censorship or suppression of AGP among the academics and amongst the intelligentsia. So really, in many cases, it's like a reverse engineering process. The patients are the ones educating the clinicians. I mean,
exactly.
I just recently met this lovely woman, AGP. I mean, basically, I told her, once we got to talking, I felt like she was AGP. She fit the description. So I told her, have you heard about AGP? She had, just recently. So I said, okay, well, I directed her to my channel, of course, my content. And also what she did was she watched some of my videos. She found them very informative and illuminating. But she also has a therapist that she meets on a weekly basis. And she actually directed my content towards the therapist and said, oh, I think you might want to check this out. So now her therapist is watching my content, has been like educated on what AGP is. So I mean, little by little, like one therapist at a time, the patients are kind of educating the therapist, and hopefully the therapist kind of divulge and tell their colleagues and peers, oh, have you heard about this? My patient told me about this. Because it's like, I'm so grateful like what you and Kevin are doing, but I'm just hoping that in your wake, there are like young academics now entering college that are also wanting to be inspired by by what they're seeing and continue to and want to study make AGP like
Yes.
their career once they graduate. I mean, it can't, because it can't end with you and Kevin. This has to continue. It can't be like a lost art, because AGP will never go away. I mean, unless they have
No.
unless there's like some drastic neural surgery that can rewire somebody's neurons, which I hope to God never exists, because I don't want to.
Likewise, we wouldn't want to lose AGP from culture.
So I mean, as long as AGPs exist, there needs to be like a continuing, like roster of intergenerational academics who are going to continue to study this. I'm hoping, like,
yes.
I mean, there's this one young woman I know on Twitter. She's studying psychology. She's a self-aware AGP. And I told her, well, you know what? You need to be like your generation's Anne Lawrence, because you're studying psychology. You know your AGP, so you know what your calling is. You need to study this. And I hope when she graduates that she'll kind of be basically like the Zoomer equivalent of an Anne Lawrence, because this needs to continue. And that would be wonderful. Like that academics coming from within the AGP family are the ones that are going to keep propelling this. Because many of us are quite many of us are quite brainy. We're actually, I mean,
yes,
yeah. I mean, at the risk of sounding immodest, many of us seem to appear to have like high IQs, but very well suited for academics, for like higher knowledge, higher studies. So hopefully, AGPs enter into psychology, psychiatry, the medical profession, and can become like endocrinologists, therapists, counselors, psychologists, and kind of be like this self-contained academic family that's coming from within the very community that they're serving. I believe it will happen. It's just that's my hope.
Oh, I love that. That's what a beautiful vision for the future, and for the and talking through these words, we're able to in some ways describe this entire type of person, culture that's growing around it, and that will continue into the future. And having this language is so important. And like anything that's important, and that hinges on issues of sex and gender, we have the theological opposition, and we also have ideological opposition. And I often think ideological stuff and theological stuff pretty similar. Heuristics people use to make sense of the world, to feel comfortable in various ways. And for those of us who are interested in understanding ourselves and the world as it is, even the uncomfortable parts, these ideological and theological heuristics will always be there to try to ruin us and make it hard, and try to cover the path with woo-woo and whatnot. And I think that the truth will prevail, and I think that the truth has beautiful social consequences, and I think that people will see that within our lifetime.
Well, ultimately, I mean, also what I'd like to get across is also like I think the root of all this opposition is basically, I think it's the reason I think there's this rabid opposition now to trans women specifically is because they see it as like the most like direct, like affront, insult, threat to patriarchy. It's like what can be like the most like offensive thing to a patriarch? A biological male, somebody who's been like anointed with the sacred XY chromosome, renouncing their masculine lineage and defecting to the other team, to like this the so-called inferior sex. I think it's basically it's what it is. It's like I think like what they see is like emasculation, or if feminization is like the most like dire existential threat to patriarchy. It's like, oh my God, we're losing like all the future chauvinists, the future like the misogynists. Oh my God, yeah.
If you can write a paper on how AGP can help unsettle the patriarchy, I think you'll really wrong foot ideologues of all types, the far left academic types who don't like AGP because they don't understand it and it just sounds like something that they shouldn't like. Well, you'll be arguing that this concept can be used in the service of something like dismantling the patriarchy, and maybe that will lead them to explore this phenomenon in more depth than simply as a bad word that nasty people use. And I think that would be useful. I'm realizing, and I hate to be so sudden, I'm realizing that I need to start to wrap up now. Is that,
So
is that all right?
Oh, of course. I mean, you've been more than generous with your time. I so greatly appreciate the time we've had. This has
Oh, it
been a
was so much
wonderful
fun.
conversation. Yes. So
So much fun.
of
And
course, I mean, yeah.
oh, and could I? And I'm happy to meet again if there's any other questions you have.
Oh yeah, I would love to have like
Yeah.
you or Kevin or any of my other guests
Yes.
back for follow. Of course, I mean, yes, this
Yes.
is like an open. The door's open. I mean, I would love for this to continue to be like an ongoing endeavor as far as like
Oh,
as
I
far as
love it.
yeah.
And could I ask a special favor? I don't know. Would
Of
you ever be
course.
able to send me a link to just this raw recording? Because I have students, well, not students, I have clinicians here I'm trying to train. And so I've got 16 clinicians and I'm trying to get them to understand autogynephilia. And I'd love you to speak to them directly if you ever wanted to. If you ever wanted to Zoom into a meeting and speak to them, I'd love that because they haven't had that option. And if you were open to that, I'd love that. And I'd love them to see a recording of us talk, one, to fill them in on some of the basics that we've discussed, and also get an understanding of who you are and the kinds of questions they can ask you. Would that be of interest?
Oh, Dr. Morandini, that would be like a dream come true. I would love to
Oh,
speak
I'd
to you.
love that.
I would love to do it. I mean, you set the time and a date as long as I will make the time on my end to do that. I would love that. Yes.
Oh,
Oh,
well,
I mean, you were more than gracious and wonderful to be on my space. I'm more than happy to be a guest on your space and
thank you.
of course, yes.
Yes, and if you feel, obviously, I won't post your content anywhere. That's your content to post, but I would love to send it just to, well, show it to some of my clinicians so that they can learn about this, because I think even some of them who are sort of open to it, they struggle to understand the concept. And it's rarely the case that I have time to speak to them for 3 hours about it, nor do I get to talk to them with a very knowledgeable and clever AGP trans woman. So I think this recording would be hugely helpful for their professional development and understanding of the clients they see. So I don't know if you, before you cut it up and do it for the final thing, if you felt comfortable just sending me a link to the recording that I could just show in its entirety.
Oh, of course.
Not online, just in the clinic. I'll just save it to my computer and they can just watch it on my laptop.
Oh, of course. I mean, rest assured. I mean, my content is meant to be disseminated to as many people as possible. It's like, yes, it's like free and open for anybody to share, because I want my content to do as much good as possible. And like in my own very modest way with my space and my channel, I'm just trying to show my AGP family that I love them. And yeah, I'm trying to do like the most positive thing possible. This is my calling. This is my passion. AGP, acceptance, and love. So anything I can do to forward that, I'll climb the highest mountain, swim the deepest sea. You name it. I'll cross the hottest desert. You name it. I'll do it.
Thank you.
Yes, by all means.
Thank you.
Well,
I
mean,
pleasure.
yes. Well, Dr. Morandini, yes, like I said, I don't want to keep you from your next engagement, but thank you so much for your time. I so appreciated this. Yes. And, and dear viewers, this concludes this installment of Transgender in the Blender. Dr. Morandini, yes, thank you so much once again. And it's been a pleasure.
It's been a pleasure. Thank you so much for having me on. And thanks so much for what you do. The way you speak about this, your depth of understanding and the metaphors and the positivity. I think this is a really important way of opening up this new generation to these ideas. You're doing great work.
Thank you so much. In my modest way, I'm just trying to make a positive impact in this world. So
you are, and you can feel that it's coming from a positive place.
Oh yeah.
So well done, and thank you for the channel.
Yes. Okay, and thank you, much lovely viewers. So I've been Christina with a. Thank you so much for watching. I love you all, and until later, bye-bye.